We're good. I understand we're good. Check, check, check. Ben, are you in the house?
I am in the house. Here,
Excellent.
present.
I'm sure there may be a few of these situations throughout the next 4 hours where we're doing check, check, check. Can you hear me? Can you see me? Turn your camera on. Welcome to our very first ever Stream-a-Thon with 98.3 Fly FM and Pure Country 99 to raise money for University Hospitals Kingston Foundation. We're pretty, like I say, we're going to be hanging out here for the next 4 hours right up until 2 o'clock. And the goal is to raise as much money as we can for our hospitals right here in Kingston. Pretty excited. I don't know. I'm pumped. I don't know about you, Ben. I feel giddy about this whole Stream-a-Thon thing.
I'm even more pumped because we have a matching gift that has been passed along to us. It comes to us from the International Brotherhood of Electrical Workers, Local 115. They will be matching donations up to $25,000. So if you're thinking to yourself, oh, I'd love to donate, but it doesn't feel like a lot, your donation will be doubled right up until $25,000. So every little bit helps. And obviously we appreciate anything that you might be able to pass along to a really worthy cause.
Yeah, and when we spoke with Dr. Mccoy, who's the CEO and president of Kingston Health Sciences Center last week, he was even mentioning how even the smallest of donations, whether it's $5, $10, or $20, it really does go a long way. I mean, obviously, there are people in the community that make big and generous donations to the hospital foundation, but we really do need every single dollar possible. And with that matching donation, it's a great way to double it. So we can't thank them enough for that. And we have also, this is fresh news, by the way, less than 2 hours ago, we actually issued a challenge as well. And if you go to the Fly FM Facebook page, you will see that because we have this $25,000 matching donation, we thought, well, let's try to get them to use it all. So if we can reach that $25,000, we've said that we'll do something fun, something crazy, something embarrassing maybe, just to help add a little inspiration for you to donate today.
So there you go. You can send us some suggestions over on our Facebook page if you've got an idea in mind for something Reed and I could do if we hit that number. We're pretty open. I mean, you are talking to the people that shave their eyebrows off. So yeah. not much isn't on the table.
And for one of us, they've almost grown back.
Yeah, 50% of us had some success with that.
So, yeah, like we mentioned, the Stream-a-Thon is going on until 2 o'clock this afternoon. You know, if you're watching it right now, then you know we've got a link up on the University Hospitals Kingston Foundation website, as well as we've got the link on our Facebook page as well. So by all means, share it with your friends. Let's get as much people as possible checking this thing out, because we're going to have some entertainment as well. Thanks to our friends over at Pure Country 99. We get the Hunter Brothers coming up in a little bit. Jason Mccoy is going to be joining us, George Canyon as well. And throughout the 4 hours as well, we're going to be talking to lots of doctors to talk about the need and the importance of fundraising here in our community. So I think that should lead us into perfect timing for our very first guest. Wouldn't you say, Ben?
I would. Let's do it.
Okay, so let's do it. We'll bring on our first guest on the Stream-a-Thon here. It's the president and CEO of Providence Care, Kathy Zabato. Good morning, Kathy. Are you there? I said we'll have a few of these throughout the morning.
Yeah. Tech diffs, they call them.
Turn your camera on. Kathy is going to be clicking in a few seconds, and we're going to talk a little bit about Providence Care and what's going on over there. Obviously, when we talk about University Hospitals Kingston Foundation, they're the fundraising arm for Kingston Health Sciences Center, and they represent Hotel Dieu and KGH, as well as Providence Care and Providence Manor. So one of the great things.
The one thing is, though, I got to say, I'm one of those people that, first of all, just waxed this phone. Secondly, I guess kind of assumed that the government covers just about everything. And, you know, what could they possibly need this money for? And over the past couple of weeks, my eyes have been completely opened to how much need there is for that support and how much it is that they're being affected right now, given the present circumstances we find ourselves in.
Well, you're absolutely right, Ben. What the government does actually is they cover 90% of the building costs. So you're building a new building. We're going to talk about the redevelopment over at KGH, and that's going to be potentially a 12-story tower. So what the government would do is they'll cover 90% of the cost of building it, but then the community, Kingston, we've got to cover the other 10%, and then you got to put the beds and you got to put all the other equipment that goes along with this redevelopment project. You got to raise the money for that as well. So that's one of those things that I didn't know up until a couple of weeks ago, is that the government does not fund. We talk often about our healthcare system in Canada and how it doesn't cost anything to go to the doctor. But when it comes to these projects, like I say, the government's only providing 90%. So
hashtag the more you know.
Oh, okay. I'm getting word from our producer, Ben.
Oh, nice.
Kathy, can you take your mute off, I believe, and we'll be able to bring you in.
It is off. My mute is off and my video is on. I've been listening and watching you for the last few minutes. So
oh, nice.
There we go.
This is what we're going to find out here, Kathy, over the next 4 hours, is just who's tech savvy and who isn't. And it's all new for everybody. And, we've seen radiothons and telethons in the past, but a Stream-a-Thon is pretty new. And we're pretty excited about it because, as you know, the last few months, Zoom has become a pretty big thing. So anyway, glad to have you here. Welcome as our first guest to the Stream-a-Thon.
Thank you so much for having us. And I am really excited to be able to tell all your listeners that local share that you just talked about helped immensely Providence Care in the past. I think you're all aware that 3 years ago, we opened the Providence Care Hospital. $42 million came from the community in that 10% local share and helped us outfit our hospital. And what that has done through this COVID pandemic, because of the design that we had, allowed us to keep our patients safe and our people safe, our staff. We have had 4 outbreaks, 2 at our hospital, 2 at our manor, but the 2 at the hospital, we were able to distance people. We were able to keep people safe. And in addition to that, working closely with public health, we were able to add an additional 200 beds to Providence Care on our units and through our classrooms, our clinic areas, our research area, and in Founders Hall, to be able to be prepared in this community to have an additional 200 beds happen on this site. So we were well prepared for COVID in the region. And in the interim, we were able to be a regional site for KHSC to send patients over to us, for Quinte Health to send patients over to us, Brockville, also LNA Hospital, and Persimmon Falls. So we became a regional center for people to help, and that was all related to the money that this community donated to this wonderful organization. It's not just a shiny, lovely looking brand new hospital. It's functionally been able to help this community.
Up until we find ourselves with a vaccine, what do things look like going forward at Providence Care?
So we still have to socially distance or physically distance. We still have to wash our hands and tell people that are not feeling well not to come to Providence Care. We still have to be very vigilant in knowing that this virus is out there. I think you might have heard in the last few days, there's been new cases identified. As we're opening up and as we are a regional center and accepting people either to our hospital or to our long-term care manor, we have to isolate people when they come. We have to make sure that they've had the swab to be able to identify if they're COVID positive or not. We do still have to be vigilant, even though it's summer and everybody's outside. We're blessed by the weather to be able to get outside because COVID thrives in crowded places, closed quarters, and in crowds. If you look at those 3 C's, we're able to get outside in the warmth and stand apart, the likelihood of the transmission will be a lot less, but it's still there and it's still circulating in our community and the communities around us.
We were talking with Kathy Sabato. Am I pronouncing that right?
Zabo. Zabo. Either the S or the Z, pick one. Not both.
We'll go with Zabo.
Go with Zabo. Good.
Zabo is president and CEO of Providence Care. You know, you're right. There's a beautiful building down on the water that was built 3 years ago. Maybe there's people that are watching right now this Stream-a-Thon that don't know a lot about what goes on over at Providence Care or Providence Manor for that matter. Perhaps you can talk about the difference in the two and what happens in those buildings.
Yeah. Providence Care is a great organization that provides 22 community programs sited all around the region. We have a long-term care manor that's a long-term care home that houses 243 people who live there. And then we have Providence Care Hospital that has 270 beds that specializes in subacute services, which are rehab, rehabilitation, complex care, palliative care, and mental health services. So we do everything except we don't have an emerge, we don't have ORs, we don't have a neonatal intensive care unit, we don't do maternity, we do everything post-acute. One of our patients that we share with KHSC put it very eloquently when they said, KHSC saved my life, Providence Care, you gave it back to me. Because they came into the hospital for rehabilitation care, stayed here for about 6 weeks, then went home on our community programs and had outreach programs that helped them continue to rehabilitate and are now living a new life based on their activities of daily living. So we do everything else other than acute care.
From a Providence Care perspective, why do you feel like it's so important to support the University Hospitals Kingston Foundation?
Yeah, we're very blessed that in Kingston we have some very generous donors. As I said before, they donated 42 million. When Providence Care and when KGH and when Hotel Dieu used to solicit donations from donors, they said, look, there's only 3 of you here. One of you does ambulatory care, one does acute care, one does all the rest of the care. Why don't you guys all get together and come and ask us once for money and you decide what are the greatest needs in this community? And that's how University Hospitals Kingston Foundation was born. It was born out of the community's request to say, we will support the hospitals here, but we want to give one donation. So together with, in the past, those 3 hospitals, but now the 2 hospitals, we sit down with UHKF and say, here's the priorities. And UHKF then goes out and raises money for both of us. And now our priority for Providence Care is to rebuild the manor. Our priority was the hospital, the community stepped up big time for that. And now our next priority for Providence Care is Providence Manor. So that's why we're very fortunate to work together with KHSC and with UHKF to be able to tell the community once what the needs are and hopefully ask them to commit to one donation that can be used for both of us. They can still identify a donation that they want to give specifically to Providence Care for something that is our priority or to KHSC, but the idea is one ask, one donation for the benefit of this community, and both of us do different work.
And Kathy, you addressed that the next project is with Providence Manor. Why don't you tell people what it is that the conditions of Providence Manor, what you are looking to do with it, and how much money is going to be needed?
Yeah, so we have been approved by the government to build 320 beds as our new long-term care home. The Sisters of Providence, who continue to be very generous and inspiring to the work that we do, have graciously donated acres of land on their Mother House property site, which is on Princess and Sir John A, to allow us to move the manor over to the Mother House site. So that building project will be at minimum $100 million to move the manor over there. Given the new design that we want to be very clear about donating to continue to keep people safe, because COVID has opened our eyes to a whole bunch of new needs. It may even go up as high as $125 million that we'll need to operate the manor in the future, to build it and operate it, to be able to keep people as safe as possible and keep the staff as safe as possible. So our new build is Providence Manor. It will move from downtown Kingston over to the Mother House site. We have to raise money. It's equivalent to the local share, but it's not called that. We need to go to a bank and get a mortgage, just like you'd get a mortgage for the house, to build Providence Manor, but we need the community support to help us get started to build that piece, or have that piece of money that would be equal to what is called a local share from a hospital perspective. So we need to have about $20 million to start. Our bank has been very generous. They say, you know, we like investing in you. You've been a good customer of the bank, and the care that you give, and you manage your finances well. We've got the bank lined up already, but we need to have more money to get started. The reason we have to move is the building over on Sydenham and Montreal Street. Parts of it were started in the 1800s, probably around 1891, when the convent was there. And then the sisters kept adding to that. It doesn't meet the local standards. We don't have a sprinkler system in there. We don't have enough space in each room to have each patient or person that lives there have their own washroom. Things that we need now that weren't built in back in the day.
And do we have a timeline for this move, this new project to get underway?
Well, except for COVID, our timeline was to get a shovel in the ground by, next summer. And it was supposed to be up and running by December 2022. And that's not too far along the road here. I think COVID has put a pause on that. So I would say that we will have the building up and running by December 2023 now. Our long-term care licenses become null and void December 31st, 2024. So we have a bit of a runway with that, but we'd really like to move as soon as possible. The sooner we can get the money raised, the sooner we can have our final plans approved by the Ministry of Long-Term Care and get money and get the shovel in the ground and start to go.
And is it possible to give people a sense of how much funding has been affected by COVID? Because obviously you can't have fundraisers as you normally would.
Right.
How much has it affected Providence just in the past little while?
Yeah, well, I think we had to cancel our gala this year, UHKF, but the sponsors and everybody continued to support. So UHKF did raise a fair amount of money through that one big event. I'm on the board of UHKF as well as part of the recipient. I would say that they're on track to continue to raise the money. The community has been generous. The ministry has supported some capital expenditures at the hospital and at the manor, but what they've been supporting through their capital investments have been more around personal protective equipment and minor modifications to keep people safe. So the community has continued to be sensitive to our needs. I think some of the strategies that UHKF were going to use to raise money, we had to put on pause. Some of the other areas of Ontario have put full page ads in to ask people to donate. Our foundation has said, how do we really want to secure the donor's commitment in the long run versus a full page ad in a newspaper to say give money? But I think they are gearing up again to say COVID's the now normal. It's not just the new normal. It'll be the now normal for the next couple of years. We have to continue to reach out to the community and have them support us. We've had some very generous donors in the past. Both the Sisters of Providence and Britt Smith have been very kind and generous to the healthcare system in Kingston. But there's other donors that are here that have been committed donors for a long period of time, and we want to make sure that everyone has the opportunity to continue to give to Providence Care.
Yeah, we really do have world-class citizens and world-class healthcare workers here in Kingston, do we not?
Yeah, we absolutely do. And I think we're such a small community, but we work really closely together. So if you look at the work that Dr. Kieran Moore did right at the start when COVID first came on the radar for everybody, and Dr. Gerald Evans, he's our infection prevention and control physician, and he also works at KHSC, and he's part of the university faculty. But together, and the work that Dr. Moore did about transitioning as food inspectors into nursing home inspectors helped us all make sure we were serious about infection prevention and control and having the right personal protective equipment. Working closely together, we never let our pandemic supplies get reduced. We continued to keep our pandemic stock up to what it would be. So the initial wave of COVID, our workers had the PPE that they needed to continue to operate. And we ramped up very quickly at Providence Care in the Manor into screening vigorously to try to keep COVID out of the organization. So that close-knit community piece of how we operate here kept us in good stead all the way along.
Yeah. Thank you very much, Kathy, for joining us this morning and being our first guest on our Stream-a-Thon and talking about all things Providence Care and just general with the University Hospitals Kingston Foundation. I really appreciate you shedding a light on the fantastic work that you guys do down there. And a big thank you very much to all the healthcare workers over at Providence Care and Providence Manor. And we'll continue to try to raise some money here with the Stream-a-Thon. Like we said, we talked about having generous Kingstonians. So we hope that holds true today with the Stream-a-Thon. And that's it. We got through our first guest on the Stream-a-Thon this morning. Thank you so much.
Well, I guess I'm glad to be your test case, and I'm glad it worked out so well. So thank you so much, and thanks to the people that live in Kingston, and their generosity is mostly appreciated. And go Providence Manor, go.
All right, Kathy Zabel, President and CEO of Providence Care. Take care, Kathy.
Thank you. You too. Bye-bye. I'll leave the meeting now.
Yes. There's
etiquette involved here. Okay,
that's right.
Bye.
Bye-bye.
We actually prefer that everyone announce that they're going to leave the meeting today. We'll be giving out. We'll have prizes
leave the meeting at some point.
That's right. We'll have prizes at the end for whoever leaves the meeting in the most dramatic way possible. Maybe like some candy. I don't know.
Well, excellent. As mentioned, we're going to have some entertainment as well along the way with this Stream-a-Thon. So before the end of the hour, we're going to be hearing from Jason Mccoy, who not only is a fantastic country artist, he's also a radio announcer as well, Ben. And I'm just waiting for that moment where they say to us at some point, you're not a professional artist as well, hit the road. So we're going to continue to do the Stream-a-Thon right up until 2 o'clock. And I'm seeing our producer is saying that we're next guest is ready to go. So yeah, we're going to do the Stream-a-Thon right up until 2 o'clock this afternoon. Thank you so much for joining us so far. And we're going to get to our next guest, who is Krista Wells-Pierce. She is the Vice President, Planning and Corporate Support Services for Providence Care and the Vice President, Planning for Kingston Health Sciences Center. Krista, are you there?
Hi, guys.
Oh, she's kind of there.
Is she kind of here?
No, you're there now. We're good.
Okay.
What's that supposed to mean? Hi, Krista. Good to see you.
You too. How are you guys today?
We're doing great. It's beautiful, lovely day. Excited about sharing some information with the community about what goes on with our hospitals, raise some money at the same time. So yeah, all is good. You got a pretty lengthy title there, Krista. Did I get it all correct? Was that all?
Did. I have the pleasure of working for both Providence Care and Kingston Health Sciences Center. So it makes for a bit of a mouthful.
Yeah. Well, tell us a little bit about yourself and maybe how you even got to these roles, Krista.
I'm a Kingston girl, proud to say. And this wonderful opportunity actually sort of fell in my lap when I finished grad school. I went to Dalhousie and had a couple fun years in Halifax, and came back to Kingston right when the government was starting to reinvest in our buildings here in Kingston. Started planning the new Providence Care Hospital over 20 years ago, and redevelopment phase 1 at the Kingston General site, and a smaller redevelopment project for the Hotel Dieu site. I'm still here, which is great. And my role has expanded. Got planning at Kingston Health Sciences Center. So I know today we want to talk a little bit about the redevelopment project for the KGH site. And then planning in a portfolio of facility related services for Providence Care, as well as quality and risk management, patient relations, and IT, food services, a variety of stuff. So a great team that I get to work with at both organizations every day.
I got to say, in getting ready for this Stream-a-Thon over the past couple of weeks, Rita and I have learned 10 times more than we have ever learned before about what everybody does, how the health community works. And we wanted you to tell us a little bit about the new tower that's in the works for Kingston Health Sciences Center, and how that's going to work and benefit the community.
It's been a long time coming, Ben, a long time. So we invested at KGH just over $120 million over 10 years ago now. We finished the development of the cancer center, the mental health, the acute mental health beds at KGH, pediatric unit, the inpatient unit, the ICU. So that was what we called phase 1 redevelopment for the KGH site. And immediately on the heels of completing that, we started talking to the government about what was next. And it's a significant list of space that, although in all of the organizations in Kingston, so both Providence Care and KHSC, all the buildings we operate, we provide wonderful care every day. But I was listening to a little bit of what Kathy was describing. The buildings are just old. They're sort of past their best before date, if you will. And so we finally have had the opportunity to now say to the government, we still have a really long list of space at KGH that's past its prime. So the new tower is going to replace the emergency departments, probably the space that most people are familiar with in terms of needing that immediate healthcare attention, and it's crowded, and it's dark, and everyone's literally on top of everybody else in the emerge, right? So the emergency department is going to more than double in size. We also have a new labor and delivery suite. So for everyone who's had babes, again, Connell 5 space is a little past its prime. Care is wonderful, but it was built in the 50s. So it needs to be brought up to present day standards. The NICU, so for our young preemies normally, who arrive a little bit ahead of schedule, and need to go into the NICU. Very crowded. It's essentially a wide open space for listeners who haven't been in the NICU. And modern day says everyone should have their own room. So parents and the neonates, private rooms as opposed to everybody being in one large wide open space. We also have the clinical laboratories. So speaking of COVID, I know Kathy was talking a lot about COVID. That lab is doing magical, incredible things to keep the tests running through for KFLNA and surrounding areas actually. But they're literally on top of each other. Building built in the 40s. And now it's 2020 and they've done magic with technology, but the footprint is just far too small for what they do. Our operating rooms, also 50s vintage, part of them in the newer kid wing were in the late 80s, but relatively speaking in the pace of change in healthcare, really old space. So brand new surgical suites as well, and all the pre and post care environment that comes with a surgical suite will be redeveloped. And that list of projects was included back in 2012, believe it or not, and the government said, yeah, try working through your next phase. So through the next phase of planning, and given the passage of time, we now are also going to rebuild our pharmacy. And they've recognized the need for additional inpatient beds at KGH. So they're letting us add 4 stories on top of what was going to be an 8-story tower. And we're fitting up 2 of them with new inpatient beds. And then 2 on the very top will be shelled in for future development of bed space. So it's a really, really large project, but not too soon, that's for sure.
I'm trying to picture how this whole thing is going to work and how you build this thing while you obviously got to keep what's going on already over at KGH. You mentioned sort of that the entrance part that most people know on Stewart Street. Is it getting all the redevelopment project, the tower? Is that all at that same spot, or is it shifting, or how's that all going to look when it's done?
It's going to be a long process. So we have to demolish a series of existing wings. So no impact to the flow. The main entrance will stay as the main entrance. But we have to demolish wings, build in their place, put people into the new part of the building, demolish the building they came from, and build the other half of the building in its place. And then do a little bit of shuffling. We're looking right now at hopefully a 6-year construction period, because we have to maintain operations. As you said, Reed, we can't turn everything off and say, oh, we're reopening. Yeah. So we've got a really tight site. You know, we're landlocked on a city block, obviously. And so we have to do it in a very methodical way, maintain operations without question. And it's going to be a long haul, but the end result will be magic, I'm sure.
We are talking with Krista Wells-Pierce, who I got to read your title because it's so huge. Vice President Planning and Corporate Support Services for Providence Care and the Vice President Planning for Kingston Health Science Center. That's got to be a massive business card. In terms of the effect that COVID has had on the funding needed for all of these massive projects, I'm sure it's slowed everything down. Can you speak to specifics of how it's affected fundraising so far this year?
The community has continued to really support, obviously in the face of COVID. We had lots of people knocking on the doors, wanting to know how they could help, wanting to know how they could give those visible thank yous to the healthcare teams, to the staff, and see if there were ways that they could support patients and at both PCH and at KHC, but also our residents at Providence Manor who were separated from their loved ones, right? We haven't been able to have visitors. only in very, very specific circumstances have visitors been allowed up until recently. So the community has had that great groundswell of how can we support the hospitals like they always have. I think to Kathy's point earlier, our largest event that the UHKF hosts every year, which is a lovely gala dinner in March every year, was canceled. But the donors, the sponsors for tables said, keep our money. We know the event has been canceled and we can't come and celebrate fundraising with you, but we don't want our money back just because you're not giving us a meal. So that support has certainly continued. And I hope that COVID has put a different lens or given people a different perspective on how incredibly essential the system as a whole is. People obviously, when they need healthcare, and certainly, going to emerge and getting those acute services at Kingston Health Sciences Center, that's the experience that most people have, obviously, earlier in your life. But the flow of the entire system depends on the acute services that KHSC provides and those subacute services that we have at Providence Care Hospital, the community-based services that our community programs at Providence Care provide, and long-term care beds, not just Providence Manor, but obviously in the context of fundraising Providence Manor. I think it has really, to your point earlier, you guys said you've learned so much more about the healthcare system just by preparing for today, but I think COVID has really shed a light for people on how the system actually is completely interdependent. Probably more so than they've ever had to think about it before. So I'm hoping that it's going to entice people to either continue donating or maybe to start donating. And every little bit helps. They don't have to be significant donations. And that people will just continue to support us. You hear about the facility related issues in long-term care, right? And as a result of COVID, people are now aware of some of the environments that were built to a standard from days gone by that unfortunately has led to some very unfortunate circumstances and outcomes for long-term care homes, not just in Ontario, but around the world. And so having the opportunity to build new space, whether it's the new Providence Manor long-term care home or the new environment like the new emergency department, the new NICU, all of those spaces that are going to give us a little bit more elbow room to provide the care that needs to be provided and to have a little bit more distance than the current environments that we're in.
And if I'm not mistaken, that's a project, that redevelopment project is in the $500+ million. Is that kind of the sort of slated for this project?
That's the range. If you go to the provincial website, it says 500 to 1 billion. So that's the public facing number that's out there right now. I mean, you can imagine just the way that we need to build it and the course of time that it's going to take to build it contributes to some of that. But there's equipment that has to obviously be provided for the net new spaces. The additional incremental space that we're building is very highly technical equipment in the emergency department, in the labor and delivery suite, in the NICU and in the ORs. And we are obligated through our funding formulas with the government to foot the bill for all of the equipment. They cost share in most of the bricks and mortar. This is with my hospital hat on now, not my long-term care hat. That's a different kettle of fish entirely. But the community needs to fundraise for 100% of the equipment and then 10% of the bricks and mortar costs. So it's an undertaking. Again, very, very necessary and long overdue, and we'll continue to rely on the great support that we've had from the community in the first waves of redevelopment at KGH, and certainly in making Providence Care Hospital a reality. We couldn't have done it without the donors.
All right. Well, we will tell people to hopefully continue to donate for our Stream-a-Thon here, and hopefully Kingstonians continue to be generous. As we mentioned, the International Brotherhood of Electrical Workers, Local 115, are matching up to $25,000. It would be nice to be able to raise that $25,000 and turn it into 50 by the end of our Stream-a-Thon here. So we're keeping our fingers crossed. We're still into hour number 1. Ben and I even said that we'll do something based on whatever suggestions we get on our Facebook page as far as a challenge goes, just to see if we can try to get our way to it. But as you mentioned, and as we talked with Kathy, Kingstonians are generous, and they understand the need and the great care that we get when it comes to our healthcare workers. So thanks for talking with us this morning on the Stream-a-Thon. We really appreciate that, and good luck moving forward with this redevelopment project, and of course the Providence Manor project as well.
Great. Thanks, guys.
Thanks, Krista. Krista Wells-Pierce, Vice President, Planning and Corporate Support Services for Providence Care, and the Vice President for Planning for Kingston Health Science Center.
You know you've got a cool gig when it takes you 2 breaths to say it. Like for the 2 of us, it's like radio jerk. You know, you can get that out quick. But once you get a job title that requires a second breath, you have made it, my friend. You know what I'm saying?
Indeed, you have. So we're going to lighten things up a little bit and get some entertainment here now on the Stream-a-Thon. As we mentioned, Fly FM, along with our sister station, Pure Country 99, teaming up to do this very first Stream-a-Thon for University Hospital's Kingston Foundation. And as I mentioned earlier, Ben, not just a country superstar in Canada, but also a radio announcer. So it's just a matter of time before they figure it out, I think.
That's right. Just
but
keep
anyway,
quiet and we'll be fine.
Yeah, maybe I should just actually keep it quiet. But Brittany, who is our program director and also an announcer over on Kingston's Pure Country 99, has got Jason Mccoy. So we'll go to Jason Mccoy and Brittany now.
Welcome to the Stream-a-Thon, Jason Mccoy. We are so happy to have you.
It's good to be here, and it's exciting for me because I don't get the chance, well, I guess nobody gets a chance to travel and play live shows at the moment, but it's been a while since we've been out your way.
And we are so excited too, because not only are you a very established country music artist, musician, but you are also a Pure Country radio host, which I don't think a lot of people in Kingston realize that, you know, you're kind of on the inside in this whole radio business too.
This is incredible. A couple of years ago, I started on with Pure Country 106 up here in Barrie, Midland, and Aurelia. So it's kind of neat because I'm on the I guess the other side of the microphone, but it's still a microphone. But you know, it's neat to play, well, I guess not only your own music at times, but all these artists that I've had the pleasure of touring with, and then hearing these new artists and stuff. So I've just been a music fan. So for me to get to be able to do this is it's a little different, but it's a real treat.
Well, one of the great things with this too, I think, you know, from being an artist, but also being in the radio business, is the importance of supporting your community and being able to give back in any way that you can. And obviously with COVID-19 and all the stuff that's been happening, the communities have been taking a pretty hard hit, including our local hospitals. So we definitely appreciate you being able to set aside a few minutes to help us with this fundraiser.
Well, thank you. And it means a lot to me. It certainly hits close to home for me because my wife is an ER nurse. So I didn't realize until she got into nursing that, you know, the equipment and things like this weren't paid for by the government. And a lot of the funding, you know, comes from the community and needs to stay in the community. So things like this are not just important, but they're necessary. We need this. Mm-hmm. So a sense of community is something that hits close to home for all of us, but the medical community, my wife being a nurse, it really resonates around our home.
Now that must be an interesting dynamic. You in radio, her into nursing. She's probably been working long hours, and you've been probably getting to work from home.
You know what? We're still so our morning show, we're still going into the studio.
Oh, that's lucky.
So I go on these little adventures every day. The kids are the ones who are stuck at home. But my wife is absolutely a trooper, you know, and all of our healthcare workers, you know, being on the front line of this COVID-19 pandemic. it's one of those things that we don't want to let our guard down yet. We're seeing this progress, but you know, we can't let down our guard, because it's serious business. But hats off to all those in healthcare for sure.
And I think that's the beauty of a fundraiser for a hospital foundation is you always need it, regardless if there's a world pandemic or if it's just a regular year. They do so many great things. And like you said, I wasn't aware either that a lot of this stuff is not government funded. It's coming from the community. So to be able to rally our community and hopefully raise some money for them is it's pretty exciting for us to be able to be in a position to do that. And we're very thankful for you to be able to participate. But you go even further with your reach of support. Now, during all of this, you put out a really cool song, We Are One. And I was hoping that you'd be able to tell us a little bit about that, because I know on this side looking at it, it was a pretty big spectacle. I mean, you had people all around the planet taking part into this. And I'm just wondering how that whole idea came together and just the execution of it all. And now that it's been out for a couple of months, what are you seeing with it?
You know, I'm still scratching my head. Like I looking back, it just doesn't.
Okay.
Really,
so is there a way to, is the link on our Facebook
week
page or no?
into the pandemic really hitting, you know, first year. And, my longtime friend, they had it here in Barrie. He owns the Barrie Colts, actually. He was a musician years ago, got into business, and you know, got back into music, and we started writing songs together. We wrote Zamboni for the Road Hammers, and that was one we had a little fun with. And then when this all hit, we thought, well, we just realized, and you know, I've been saying this, that the thing that was keeping and is keeping us apart is in a lot of ways through events like this, streaming events, social media, seeing on the news communities around the world just like ours. It's bringing us closer together in a lot of ways, makes the world that much smaller. And the term "We Are One" just kind of kept coming to mind, you know, and we sat down on Skype and we wrote this song, and we really didn't have any particular goal for it. We just wanted to write a song. And then we thought, well, let's get some musician friends to record their parts in their own home studios. And then we did that. And then we thought, well, let's get some guest vocalists, maybe from, I don't know, just across the country, that kind of thing. And I was sitting with my daughter and I said, you know, this thing would be great if we had a choir on it, but I'm not gonna be able to get a choir in the middle of a pandemic. And we were watching the news, and it was the Harlem Gospel Choir. And they were talking about the shows they had to cancel. All of the artists, of course, have had to do. And she said, well, what about them? And I said, well, first of all, it's a choir. And second of all, they're in New York. They're in the epicenter of this thing. How would we make that happen? So she's 13 years old, my daughter Grace, and she took it upon herself to find a contact on the website. And she said, well, here, send an email, see what happens. So I did. I got an email, a call actually right back from the manager. And they said, we think this would be a beautiful message to send out, you know, as a message of unity. So we had them record their parts individually. And then we put it together at our studio, and then the guests kept coming, the Tim Hicks, the Hunter brothers, and then friends from around the world. Haley Jensen, who was on The Voice in Australia, Jessica Falk from Sweden, and Ed Robertson from Bare Naked Ladies. And it just snowballed, and it was just a fun project to put together. And we thought, well, let's donate all the royalties to COVID-19 relief effort. And that really centers around the Unison Fund, which supports musicians in a time of crisis, which of course is now, because no musicians are working.
So what is that like for you to be able to, I think, you know, day to day, you take for granted, you know, the impact that you can have, but what is it like for you to be able to know that you can put something like that together and to have all of that support and then being able to give it back in that kind of capacity? Like, I'm sure to you, you feel like regular Jason Mccoy, but to be able to just kind of whip that up as a brainchild and then see the impact.
First of all, I never feel like regular Jason Mccoy. I'm a bit of an oddball, but you know what? Like it was like I am such a small part of this whole thing. Like I wrote it with Jim and made, you know, the calls and tried to get everybody involved. But our producer Russ Broom in Calgary and Sean, who put the video together, is out in Calgary as well. And then all of the artists donating their time. Like this is a group, this is really a global group effort. Yeah. And so it wasn't, you know, it wasn't like me leading the charge in this, I guess to a degree, but it was one of those things where you'd ask a friend and then they'd ask a friend, you know, that whole thing. And, you know, we'd ask our management about, you know, certain artists, and they'd say, well, what about Tim Hicks? I mean, we're on the same label, and I know Tim, and so give him a call and say, would you be? Yeah, man, and the Hunter Brothers, and it just kind of rolled around. A friend of mine, Jason Priestley, we did a show for the Roadhammers years ago, and he produced an episode or a season of the Roadhammers TV series, and I was just talking to him about this project I was doing. And he said, man, Ed Robertson would be, well, the Bare Naked Ladies would be great for this. So he called Ed, and Ed jumped on board. So it was more like a friend of a friend thing. And it wasn't, we weren't really pushing for any agenda. And that's why, I mean, it wasn't just me. It was like everybody going, we love this idea. What about? And then they make the call and put it together.
And I think that's one of the best things to come out of this entire pandemic is you see how engaged people are and how much people genuinely want to help. And even for us with this Stream-a-Thon, it's on Pure Country 99, but it's also with our sister station Fly FM. And to be able to rally up a few of our country music friends to be able to help us with this, like you said, it kind of snowballs. You can kind of get one person on board, and they're like, well, why don't we grab this person? And then the next thing you know, you're all rallying together for a great cause and raising money for very much needed things that at the end of the day impacts us all.
I love it. And that's kind of, indicative of the music community to a degree, and the country community,
especially the country.
You know what I mean? Like it's this country artists, like got Thomas Rhett, Reba McEntire, they got the song Be a Light, and it just seems that whenever there's an issue, whether I remember Hurricane Katrina, and a lot of country artists really rallied around that, and I guess it's a community music, right? Like they always say country music's the people's music, and people are just, a bunch of communities, and that's what it's all about. So doing something like this, and as I say, that connection to, my wife being a nurse, it really hits home. And so what you guys are doing is fantastic, and just thanks for inviting me.
Now, off the top of your head, when do you think the last time you were in Kingston was?
Oh boy,
It's been too long is what I'm getting at. So once
this
clears up, I'm really hoping that there's going to be a show.
Absolutely. There's got to be. And I remember, when we were, touring clubs years ago, there'd be a lot of stops. We'd always stop in Kingston. It was a great place. There'd be pubs that we could play and things like that. And the last time we were there was with the Roadhammers. And I can't remember exactly where, but we got to bring the band back. I mean, like you said, it's been too long, and such great country fans. We'll be back there as soon as we're allowed.
Well, I want to thank you again for taking part in our Stream-a-Thon. I know you're very high demand these days. Everybody wants a little piece of Jason Mccoy, so we are so thankful for you to be able to spend some time with us and help us raise some money for our hospital foundation.
Thank you so much. I really enjoy, what you guys are doing. I appreciate you inviting me. And, as our song says, we are one. I mean, whether it's the global community or just, around the corner, we really are connected.
Thanks.
And thanks to Jason Mccoy for joining us on the Stream-a-Thon here. It's Reed and Ben, 98.3 Fly FM, along with our sister station, Pure Country 99, getting together to try to raise as much money as we can today for University Hospital's Kingston Foundation. Jason Mccoy, by the way, is going to be back a little bit later on. He's going to perform as well, so we can look forward to that.
Did that guy say my friend Jason Priestley?
I thought I heard that too. He definitely, and he said it so casually.
I know.
I was like, wait a second, Jason Priestley,
radio host, musician, all around good guy, friend of Jason Priestley.
I didn't hear him say anything about getting Jason Priestley to pop on this Stream-a-Thon though.
Still a few hours. Let's see what happens.
Yeah. All right. Sounds good. All right. Let's bring on somebody that we know very well. Obviously, she does the midday show. She comes on right after we do our show here on Fly FM, and she's also pregnant right now. Rebecca. Hi, Rebecca.
There we go.
Hello. Hi.
There she is. How's it going?
Good. How are you guys doing?
Good. We still can't see you.
You still can't see me.
No, we're all good now.
Oh, you got a fancy computer chair there. What's going on there with that thing?
My fancy computer chair. Yes, this is the fancy dancy computer chair. I don't know. It's a gaming chair.
Gaming read.
Yeah. Good to have you. I know you wanted to be a part of the Stream-a-Thon as well, and talk obviously to the importance of raising money for our hospitals. So we thought we would hand it over to you and talk about. I guess I would imagine now, just being pregnant, there are several trips to the hospitals.
Well, it's interesting, right? Like, sure, with pregnancy, there has definitely been, it's a bit different with COVID-19, and I'm so thankful to be where we are, because here in Kingston, like, we actually have one of just 5 neonatal intensive care units, like, locally, which is awesome, which means that if something does go wrong or something does happen, I've got experts right here in our community instead of having to drive to a whole bunch of other places. But I want to talk a little bit too about just some of the amazing doctors that helped me get to where I am to being pregnant, because it's not something that a lot of people talk about, but I'm definitely comfortable chatting about it. Infertility. I'm somebody who had to go through the IVF route until this miracle baby happened with me. So, like, long story short, I've done all the tests that you can at KGH to figure out if I can have babies or not, had loads of specialists that were able to talk with me directly and help me with all of the questions that I had about, why are women infertile? And that was really cool to happen, like, right here in our own Kingston community without having to drive to really long appointments in Ottawa or go all the way to Toronto. We have those specialists right here in Kingston. So I just wanted to highlight that off the bat, which is, not necessarily something that women in every community have access to. That was really, really cool to know and to be able to experience that we have right here in Kingston. So big shout out to all the docs at KGH.
Excellent.
Go ahead.
No, I was just, we've been hearing that time and time again, how we have just like world-class doctors here, and we're in great shape when it comes to being comfortable and knowing that we can get some great professional treatment and advice from our doctors. That's what the whole idea is, to keep supporting them and keep making sure that we talked about the Nicu, and then how raising money. One of the projects, part of the redevelopment center, is to make sure that you have your own room when you're with your new early born baby with you, and things like that, which are just going to make things so much more comfortable for moms and babies, if the time comes for that.
Yeah, absolutely. I can't imagine, having to be one on top of another with another mom in there, and you're so worried about what's going on with you, baby, and wanting to make sure everything's okay. I'm sure it offers a sense of, like, community, that you're not alone and that you get to see other moms and people going through the same thing. But to have a little bit of privacy, to have, for some instances with, young children and being sick, it can be very scary. For others, maybe it's just a quick stay in the NICU, but having those options to have that private room. I know for some people going through some really serious life-changing early pregnancy or early life challenges is going to be definitely, like, probably above top-notch care. Can we say that? Because we already have, like, amazing care here in Kingston, but this really takes it to, like, another level.
Yeah. In terms of support for the University Hospitals Kingston Foundation, I imagine, and I'm just guessing here, perhaps before you started using it on a regular basis, before becoming pregnant, you maybe had one perspective on its importance, and now it might hit home a little bit more for you. What have you, from a before and after perspective, some realizations maybe?
For what? Sorry, for
just for in terms of the importance of the University Hospitals, the Kingston Foundation, how important it is to keep it fundraised and so on.
Oh, yeah, for sure. Well, one of the biggest things, and I think I love that we keep hitting on it because I don't think a lot of people know, is that the hospitals don't get 100% of their budget covered by the government. We have great healthcare in Canada, great healthcare in Ontario, generally speaking. Like, you look at the rest of the world, it's not perfect, but it's great. You look at how, like, expensive healthcare is, all of the new technology that they have to keep up with. They used to call it bleeding edge technology. I don't know if that's, like, can use that term when it comes to hospitals, right? It's like
I have no idea. I haven't heard it.
The bleeding, like they're cutting the way. The fact that like that doesn't stop, and the fact that we can keep having all of that top-notch technology here in Kingston, like being able to see ultrasounds in utero is like really, really cool, and probably not accessible everywhere. Like I said, Kingston, I think, is one of 5 southeastern, I think it's the only hospital actually in southeastern Ontario that has a dedicated NICU unit. So having all of that technology like right at our fingertips, right here in our community, to keep up with the changes in that technology, that's the reason why we need to keep funding everything. And it's not just, you know, NICU. It's not just because I'm pregnant talking about that. We do a lot of fundraising for, like there's a run in town. You guys remember the neuro race weekend with our friends Dolores and Kyla Tozer? She had a brain tumor, and so she fundraises each and every year for the brain surgery department in order to get them funding that they need to do all of their research and get new equipment in to help people with brain tumors right here in our limestone city. Like it's literally every facet of our healthcare system that gets touched by donations that come from people like you and I, a little bit of money from the government, but grand scheme of things, it really is us, our Kingston community, that keeps us as healthy as we are, I guess.
I was glad to see that they still had that run this year, but it was done virtually, and like you know, so many other charities, the virtual run or the virtual walk or the virtual blank. Yes, it's great to still try to keep it going, but obviously you don't get the impact, the financial impact, as you would if you didn't actually do it, which is one of the reasons why we thought we'd throw in this Stream-a-Thon here today and try to bring up some of those donations so that for the runs or the golf tournaments and stuff like that that may get canceled or postponed or go virtual this year and don't have that same monetary impact, that hopefully we can add a little to that with the Stream-a-Thon today. So how's the pregnancy going? By when are you due anyway?
October 13th. It's a Tuesday. It's not a Friday. But if he shows up on the 13th, there is a chance, right, that he could have a Friday the 13th birthday. Reed, you know about that, right?
I had a Friday the 13th birthday when I turned 13.
Oh.
Some may argue how I turned out, but I think it was all good.
Well, you know, other than when it was really hot and humid, yeah, I started to get like swelling. It was the first time I had to take rings off my fingers. So I started to experience some of the traditional pregnancy stuff, but so far so good. Like, knock on all of the wood. It's been awesome.
Have you picked out a name yet?
No, but I am brainstorming them with you guys up on the Fly FM Facebook page. Put that up earlier this week. So if you've got any suggestions, do you guys have suggestions? Well, it's not going to be Reed and it's not going to be Ben. I'm sorry, guys.
As we've been talking about, we've got a $25,000 matching donation from the International Brotherhood of Electrical Workers, Local 115. They're matching up to $25,000. That's donated during the Stream-a-Thon. If we hit $25,000, would you consider, what's the acronym? IBU?
IBU? That kind of sounds like owl in French.
Yeah.
IBU? Hey, Chris, what do you think of IBU? Yeah.
Yeah. You got to tell them the whole story, though, not just by itself.
He's not French whatsoever.
An electrician.
What's that?
Maybe he'll grow up to be an electrician along the way.
It's a great career path. Why not? If he's better at math than me, he'll do just fine.
But well, if we Ben, you know, the other angle that we could go with this is we said that if we raised 25,000 during the Stream-a-Thon, we would do something embarrassing or a challenge or something like that. Maybe it's us that need to change our names to EBU 1 and EBU 2.
Or just add it, at least make it a middle name or something.
Do I have to clear that with the boss, or I don't even know?
I don't know how that works either. We'll think of something, and of course the suggestions, you can still give them up on our Facebook page, and we'll try to strive to that 25,000 with the Stream-a-Thon. Excellent, Rebecca. Well, thanks for joining us this morning and being a part of it, and best of luck along the way with the baby. And yeah, we'll see you really soon.
Yeah, sounds good. Thanks, guys.
All right, take care. Yeah, we've been getting some interesting suggestions, Ben, I must say, up on our Facebook page. Let me know if any of these sound like something you're interested in doing if we raise 25,000. Walk barefoot across Lego.
You've got 3 kids, though. I feel like you would have an unfair advantage with your experience.
How about this? I think I have the advantage with this one as well, just based on knowing your swimming abilities. Swim to Wolf Island.
Do I get floaties? Can I have like one of those inflatable waist things?
Yeah, I'm sure. Yeah, we would want to practice safety first.
That's right.
And what was the other one that I saw? Oh yeah, this one's pretty cool as well. I like the tie-in too with our healthcare workers. Parachute over the hospital with white banners to say, "Thank you, healthcare workers."
Whose idea was that?
That came from Jade Allen on our Facebook page.
Parachuting.
Parachute, yeah.
Ugh.
I've never jumped out of an airplane before, but anyway, some of the suggestions that we got. Stream-a-Thon is going on until 2 o'clock, and this is the first time we've ever done this thing along with our sister station, Pure Country 99, 98.3 Fly FM. I'm Reed, Ben as well, and talking with various guests throughout the morning and into the afternoon as well. And I do believe we are ready to. We are good. Oh, yes, okay. Mike is here, is what I'm told. Mike is here. That must mean Dr. Fitzpatrick, Chief of Staff, Vice President of Medical Affairs at Kingston Health Sciences Center. Or do we just call you Mike?
That sounds good, Reed. Thank you. Thanks for having me. And Ben, thank you.
Hey, good to see you. There he is. Welcome to the Stream-a-Thon.
I'm delighted to be here, guys. Thank you for doing this for us. This is really wonderful. What a lovely morning.
Yeah, no, we're loving it. This has been a lot of fun and certainly eye-opening at the same time. So as I mentioned, you're Chief of Staff, Vice President of Medical Affairs at Kingston Health Sciences Center. Maybe tell us a little bit about yourself, your title, and who is Dr. Mike Fitzpatrick anyway?
Yeah, so I'm a guy who graduated in medicine in Ireland and then came over here 20 odd years ago. And so I'm the Chief of Staff and Vice President of Medical Affairs at Kingston Health Sciences Center, and I'm a lung specialist. That's what I do for a living before, and still currently I do that work as well. But this role gives an opportunity for leadership, and that's something that's been very important to me to give back to our community and try and make our health care even better than it is already. So it's a real opportunity.
For anyone that might not know, would you be able to explain the difference between what happens at KGH versus what happens at Hotel Duke?
Sure, Ben, absolutely. So let me just maybe explain at the outset that that Kingston Health Sciences Center comprises those 2 hospitals. That's Hotel Duke Hospital and the Kingston General Hospital. And they came together, they integrated on the 1st of April, 2017, to make the Kingston Health Sciences Center. And that includes a research center and also the Cancer Center of Southeastern Ontario. And we're the major acute and complex care site in the southeast region of Ontario. So we provide all of the acute medical care and the specialty care, like subspecialty care. I'll describe that in a moment. But in addition to patient care, we've got a couple of other major functions, and that one of those is education, both undergraduate education for medical and nursing students, and also postgraduate education for our residents and nursing staff and allied health professionals. And then we also do research. So it's really those 3 things, the clinical care, education, and research. That's what we do at Kingston Health Sciences Center overall. And for acute care, what we mean by that is things like patients coming in with a heart attack or a stroke who might need an immediate interventional procedure like a coronary artery imaging, stenting, or extraction of a clot from the brain, those kinds of things. we look after a lot of the complex subspecialty care. For example, the patients with kidney failure requiring dialysis, patients requiring surgery on the brain or spinal cord, pediatric care, neonatal care, and especially the complex obstetrical care. So a lot of very detailed, complex care is provided here for the whole region, in addition to all of the care that we need to provide for our own local community. And what's different about KGH from Hotel Do is that KGH does a lot of the more complex surgeries in-house. The shorter stay surgeries are typically done at Hotel Do Hospital. So things like hip and knee replacements, even surgeries like weight loss surgery is done at Hotel Do Hospital. Whereas the complex cardiac surgeries or surgery on the lung, for example, or surgeries on the brain and spinal cord, those will be done at the KGH site. And in addition, the Hotel Do site provides most of the outpatient clinic care, not all of it. So most of the cancer outpatient care is done at the cancer center at the KGH site, and some of the cardiac and vascular care, outpatient clinics go on at the KGH site. But all the other clinics are over at the Hotel Do site, and that includes things like neurology and respirology and the pediatric clinics and most of the cardiac clinics. And so really think of the Hotel Do Hospital as being a site that's really specialized in very efficient short stay care for surgical procedures, and most of the what we call ambulatory care, or if you like, outpatient clinic care and testing.
Dr. Fitzpatrick, you mentioned you're a lung specialist, and I mean, we can't, if you're a lung specialist, and you know, we've been talking about COVID-19 now for the past several months. Maybe shed a little bit of light on stuff maybe people don't, you know, how you get COVID-19 from a lung specialist, and we've talked about different ways to prevent it from happening, but explain exactly how it works, because it gets into the lungs, obviously, correct?
Well, it gets, it's a funny thing about COVID-19, there's a lot of inflammation in the lung of these patients, but if you go in with a scope and take a washing from the lung, you'll be surprised to find that the virus isn't there. The virus mostly inhabits the upper respiratory tract, that is at the back, of the middle and back of the nose and into the throat, but not so much living and multiplying in the lower airway or in the actual spongy part of the lung. And it's really the immune response to the virus that causes a lot of this inflammation that we see in the lung that actually kills people. So one of the most important things about COVID-19 is to remember that it's spread by droplet nuclei. So it's not an airborne spread virus. That's important because those big droplets don't travel very far when we cough. And that's why the 2-meter distancing rule is so helpful and so important, because those big droplets will fall within that 2-meter space, and you won't transmit the virus by coughing if the person's more than 2 meters away. So that's a simple and very effective tool, even more effective than wearing a mask, in fact.
Obviously, COVID-19 has had an effect on scheduled surgeries, elective surgeries that you guys have had to navigate your way through. How do you see things going as we move forward? I suppose before we get a vaccine, how do you see things moving forward?
Well, good question, Ben. Well, I think the first thing is that I'd say to all our patients or anybody else who's listening, that don't be afraid to come to the hospital. It's the safest place you could be in a COVID-19 pandemic. Our community, for starters, has a pretty low prevalence of COVID-19 at this point, because we've already taken all of the right maneuvers at the outset. And we're actually, we're a model for how this disease should be handled and prevented there's been a lot of press about that already. But within the hospital, it's even safer again, because we screen people at the door, even before coming to the hospital, to determine whether it's safe for them to come to the hospital, or if they need to wear any special protective equipment to protect them from spreading the disease to anyone else, or even if it's a low risk, we wouldn't take that chance. So the hospital's a very, very safe place to come for care if the patients need it. And the answer to your second question, which is about ramping up activities, we've initially, when this COVID pandemic came in, we really had to ramp right down. In fact, our operating rooms went right down to 3 operating rooms. Normally, we have 12 operating rooms working at the Kingston General site and 6 at the Hotel Dieu site. But we went right down to having just 3 operating rooms at the KGH site. And now we've gradually ramped back up, and currently we're running 9 operating rooms at KGH and 5 at the Hotel Dieu site. So 14 of our normal 18 room capacity. And then over the last week, we've started to ramp up the outpatient clinic care. And we're doing that in 2 ways. One, we're very carefully ensuring that we have all the safety measures in place so that patients can feel really comfortable and safe to come to the hospital to have their clinic appointment. But we're also limiting the number of clinic appointments to ensure we have that social distancing that's required, and the patients have all the right PPE. And we're asking our specialists, if they don't need the patient to come to the clinic in person, and if they can use virtual care to see the patient, to do that. And that virtual care, of course, is very convenient for the patient because they're seen at home via video camera, just like Reid and Ben and I are doing right now. But also limits the number of patients that have to be seen in clinic while being able to provide the care needed.
Dr. Fitzpatrick, from what I understand, Kingston and KGH has become sort of a center, one of very few across the province that are doing COVID testing, like right here in Kingston. Can you speak to the labs and what's happening at KGH regarding COVID-19 testing?
Thank you. Yes, absolutely. We've been very fortunate, and that's one of the great things about having a tertiary care center where we have very highly expert individuals, both research scientists and clinical laboratory scientists, clinical laboratory technologists, and also doctors, physicians who are also have a PhD degree. And these very skilled people are able to be called upon in a crisis like this. And that's what's allowed us to develop our own test site for the COVID-19 virus. This is an RNA virus, and we have very specialized equipment, but much more important, we have the expertise to run that equipment efficiently and accurately in our lab. And that's been a tremendous boon, not only to our hospital, but to our whole community, because we can do those tests and have a turnaround time that's much faster than the public health laboratory. And so it's been a real help to us for patients coming to our hospital where we need to determine whether they do or don't have COVID. And we've been able to extend that care out to our partner hospitals, including Quinte Regional Hospital, and even beyond our region, for example, into Peterborough and the Ross Memorial Hospital in Lindsay and many other hospitals. Because they need a fast turnaround time, we've been able to offer the service. We initially started doing the tests once per day, and now we're up to 5 times per day, and we can process up to 400 specimens per day, and we average about 300 plus per day. So it's been a really remarkable help to our community and to the patient flow within our hospitals and to our partner hospitals right across the region.
Of course, and we can't stress, of course, the importance of getting yourself tested at the assessment center, which I think I just read this morning has moved now to the Leon Center because of the hotter temperatures and the lack of AC at the Memorial Center.
Yeah, well, it's still at the Memorial Centre right now, but it's moving at the weekend to the Leon Centre. You're absolutely right, and for the reasons you mentioned, Reid, yeah, it's because it's so hot and uncomfortable at the Memorial Centre. It's moving to the Leon Centre, and it's going to be closed on Sunday while they do the move over, and open again for business on Monday. But that's been hugely helpful in getting patients tested, large volumes of patients, and that's been really helpful in terms of understanding what is the level of this disease in our community. And I want to reassure everybody that it's at a very low level. We do see occasional cases of COVID, and there's certainly no room for complacency. We still have to be very careful. We've got to use our social distancing, keep within our social circles, use our masking when it's appropriate. Really important to do those things. But if we do, we're winning this battle so far. We just don't want to let the genie out of the bottle. That's the key thing. So yeah, the testing has been a real help, and it's been because we are an academic health sciences center that we've been able to do that testing on our own, and we're one of the few labs that are recommended for this testing in Ontario.
And Dr. Fitzpatrick, before we let you go, obviously the purpose of today's Stream-a-Thon is to raise a lot of money for the University Hospitals Kingston Foundation, and we may have sort of lightly touched upon it along the way, but maybe just talk to the impact that the foundation has on the Health Sciences Center, and why the fundraising is so important in our community.
Yeah, thanks, Rita. That's a great question. It's really important. I think many people don't understand, and I didn't, to be honest, understand myself before coming into this position, that healthcare funding for hospitals in Ontario is not complete. And that, for example, we've got permission to build a whole new redevelopment, so-called phase 2 redevelopment of our hospital. And the funding of that is 90% from the government, and 10% of those costs are expected to be raised locally. And in addition to that, all of the equipment that we will need for the new redevelopment process, so the new equipment, the robotic equipment that we would use in our operating rooms, and much of the new technical equipment, that will have to be purchased through donations from our community. And we've been very fortunate. We've had a very generous community. We've had some tremendous benefactors who've contributed enormously to our hospitals, and we're deeply grateful for that. But I want to say to anybody listening that, even if it's a very small donation, every dollar counts, and we really, really appreciate the generosity of our patients. It's and our community. It's what makes us able to deliver the care we do. For example, many people talk about the importance of robotic surgery. We wouldn't have robotic surgery in this hospital if it were not for patient donations. We've recently bought a new specialized MRI device that provides highly detailed images that patients need for care of certain spinal and other conditions, cancer and so on. And without donations, we wouldn't have been able to do that. So this is really our community helping ourselves. We donate, we get the equipment that we need, and we provide better care for our people. It's also really important to have that highly specialized equipment if we want to attract really good specialists to our area, because they expect that equipment. They want to work at the top of their game and provide the best care possible, and they need that equipment to do it. So it's really a win-win situation. And I can tell you that just yesterday, when they heard about the Stream-a-Thon, I was given notification that our doctors have made a substantial donation as well to this Stream-a-Thon event. And we're all in this together. Our doctors are contributing to themselves to the UHKF Stream-a-Thon, and they do regularly as well anyway. But we're in this together. We're contributing. We need those donations from our community. And if, in particular, it's really helpful if you can give an unrestricted donation. That allows us to put the money to where it's best used. When donations are restricted to only using one area or another, that makes it a little bit more difficult for us to use the money where it's most needed. But if don't let that preclude anybody from giving a donation. If you have a desperate desire to donate to a specific area only, please go ahead and do that. We want your help. We need it. And if there's anything that we can do that would help to build those donations further, we would love to do it.
Yeah, and
thanks to you and Rita and Ben today for doing this. This is fabulous.
Well, no, thank you for joining us and talking about some of the great things that are going on there. And yes, it was a $5,000 donation, by the way, that we should point out that came from the doctors, which Ben and I were like, you're already doing the fantastic work that you do at the hospital, and then you're also paying into getting some of these projects done. So just, hats off to everyone over there, and really appreciate you joining us on the Stream-a-Thon, Dr. Fitzpatrick, this morning.
Thanks very much, Rita and Ben. I really appreciate you having me, and it's been lovely to work together to do this. Thank you.
Yeah. All right. Have a great day.
Bye now.
That is Dr. Fitzpatrick, Chief of Staff, Vice President of Medical Affairs at Kingston Health Science Center, as we do our Stream-a-Thon here. My name is Reed, and we are getting set to go to, I believe, the Hunter Brothers are coming up. The Hunter Brothers, we are doing this in association with our country station, our sister station, Pure Country 99. And Brittany, the program director there, has got the Hunter Brothers. So I'll throw it to you, Brittany.
Welcome to the Stream-a-Thon for the Hospital Foundation here in Kingston. We are joined with the Hunter Brothers. So happy to have you guys taking part.
Hey, everybody. Thanks for having us.
This is really exciting for us to be able to have you. And I know in my head, I like to picture that you guys are always just together, but I'm sure now that COVID-19 has hit, you probably have spent some time apart. So it's probably a little bit more of an ordeal to get everyone in the same room.
Yeah, definitely. We're used to spending almost all of our waking hours together. And so for the first few weeks, things were very, very different for us. And then we headed into farming season, where we were all self-isolated in our tractor cabs anyway. So that part was somewhat similar. But any type of musical performances and arrangements have definitely looked different over the last couple months.
And it must be so strange for you, because I know you guys are just go, go, go 24/7, and to be kind of forced into a bit of a break is probably not something that you're used to or even really comfortable with.
Got lots of home projects done, actually. So yeah, the first few weeks of quarantine there, when you're hanging out, I redid my whole entryway, my bathroom, my downstairs. It was great. Yeah.
Oh my goodness. Well, at least you were motivated, because I know some people with the downtime, they've just basically haven't moved in the last 4 months. So it's nice that you're able to tackle some projects.
Yeah, well, and the other thing is, typically through the summer, we're traveling so much with shows, which we are missing terribly right now. It's one of our favorite things to do, but it also has allowed us the opportunity to spend a little bit of time with our families intentionally as well. So, but still with the farm happening, things have still been crazy. So it's been full tilt ahead.
And with COVID-19, of course, it's impacted artists, it's impacted basically everybody, and of course our hospitals. And that's why we're putting together this live Stream-a-Thon that's happening today to support our hospital foundation. I think one of the misconceptions is that hospitals are completely government funded, but the reality is it comes back to raising donations in the community. So we are so thankful that you guys were able to spend some time with us to provide a little bit of entertainment and hopefully turn into some donations at the end of it. So I know you guys have a brand new song. And for me, I am a Maritimer, and saying the title of this song is my nightmare, because everybody makes fun of my accent. It's hard dirt. It is. I absolutely, every time I say it, I'm just like, say it fast so people don't notice. I'm like, hard dirt by the Hunter Brothers. Thank you for that. So you are going to perform.
Thinking about you.
And especially you guys being on the West Coast too. Like you have a different accent from like central Canada, and of course us Maritimers. Like, it's just.
Yeah. Seems like every province kind of has their own thing going on. And then even within the provinces, there's different accents. So
yeah, so I get made fun of profusely. So you are going to perform that new song for us. And I thought this is such a great time for this, because I know the message of the song and kind of the meaning behind it really ties in well with the spirit of what we're doing here with this Stream-a-Thon. So if you want to be able to explain a little bit about the song and then perform it for us, I will just shut off my camera so I'm not awkwardly standing in the side view, and I'll let you guys take it away.
Sounds good. Thank you so much, Brittany.
Okay.
Appreciate
I'm going to disappear here.
So yeah, this is our brand new single, Hard Dirt, and we really want to dedicate this song to all those who are working in the healthcare system right now, all those who are giving of their time, you know, and all those who are hurting through this season. It's definitely a difficult set of circumstances we've been facing in the last while. And this song speaks to struggle, but it also speaks hopefully more loudly to the hope that exists on the other side of that struggle. And, you know, that we can come through this stronger. We can come together as communities, as families, and be stronger on the other side. So we dedicate this to everybody who's listening right now, and we encourage you that there is hope in the future. The song's called Hard Dirt. Ooh, ah, ooh, ah. Bring on the heat, bring on the sun, bring on the clouds, and get over it. Said I'm the only one, yeah. Bring on the doubt, tell me I'll never be good enough. Bring on the hurt, bring on the past, bring on the memories of the pieces that I'm never gonna get that far. I'm looking up, 'cause I believe in a thing about. I grow better and harder, I dig deeper when the river outside. Struggle makes me stronger, reaching for the sky. You don't know what the rain's worth till it finds you out in the desert. Learning how my heart works, I go better and harder. Dreams keep me alive, even when I'm weak, even when I'm barely getting by. Blood, sweat, and tears for the fruit on the vine. Someday I'm gonna rise, someday I'm gonna shine. Struggle makes me stronger, reaching for the sky. You don't know what the rain's worth till it finds you out in the desert. Learning how my heart works, I go better in harder. Blood, sweat, and tears put the fruit on the vine. Someday you're gonna see this heart of mine. Blood, sweat, and tears put the fruit on the vine. Someday I'm gonna rise. Someday I'm gonna shine. You don't know what the rain's worth till it finds you out in the desert. Learning how my heart works, go better and harder.
Yay! The awkward one-person woo in the background. There we go. Hard Dirt. Make me say it again. The Hunter Brothers. Thank you so much. That was really great. And I love the message of that song. And I think it's so fitting for so many people for so many reasons right now.
Well, thank you so very much. And thank you for what you do and for everybody that's donating. It's so special. Our hometown girl here in Toronto is Haley Wickenheiser. We know that she's been very instrumental on the front lines. And so our hearts go out to everybody that has put themselves and their time and their bodies and everything on the line for the sake of helping others. That's such an amazing thing. And so thank you for all your work, Brittany, as well, there at the station, and everybody that has contributed as well.
Well, we certainly can't wait to have you guys back here in real life to serenade us with that song. We're just going to have to, by the looks of it, wait a few more months.
Yeah, that's very
Yeah, we absolutely can't wait. Yeah, we miss it, and hopefully we'll be able to hug one day.
Well, thank you so much, JJ, Dusty, Ty, Luke, Brock. We very much appreciate you taking time to be a part of our Stream-a-Thon.
Thanks so much for having us.
Yeah, big thanks to the Hunter brothers. We're doing the Stream-a-Thon. My name is Reed. Ben is here as well. We do the morning show on 98.3 Fly FM along with our sister station, Pure Country 99. Till 2 o'clock this afternoon. Thanks to everyone who's been watching so far. Help us raise money for University Hospital's Kingston Foundation. Once again, we want to send a big thank you to the International Brotherhood of Electrical Workers, Local 115. These guys are amazing. $25,000 is what they've decided that they are going to offer up in donations where you can, they'll match up to $25,000. So if you have a $5 or $10 or even a $20 donation, that automatically turns into, well, $10, $10, $20 or $40. So pretty amazing stuff. So we can't thank them enough for being a part of the Stream-a-Thon today.
Back, Reed.
There he is.
Yeah.
How you doing, buddy? Yeah.
I'm good. You know, when you were a little kid and you'd be learning to ride your bike and you had the training wheels off and you thought your mom was behind you, but she had taken off and you were riding on your own? That's what happened to you. Yeah.
Why don't we just say what those who know you really well know what always happens with Ben is his phone died, which is,
also that. Yeah.
Nothing really new. It's all good. Well, anyway, we're still here. We're still doing the Stream-a-Thon. We're still trying to raise, we're hoping to get to $25,000 if we can anyway, because we'd like to, as I say, get all those donations matched from the International Brotherhood of Electrical Workers, Local 115, who are right here in Kingston. And we don't have a tote board, but if you do go to our website, 983flyfm.com, you could have hooked up through the stream that way. You can also see the total right there on how much money we've raised so far. And do you want to hear a number, Ben?
Yeah. Can I hang on? I'll give you some kind of drum roll. 1 minute here.
Okay. 7, 2, 3, 5.
Nicely done.
An hour and 40 minutes into our Stream-a-Thon, and yeah, we're just over $7,235. So that is amazing. And as we've been hearing time and time again from the doctors themselves, that even the small donations really go a long way. And man, these projects, they are not cheap. They cost a lot of money. And so that is why we want to help out University Hospital's Kingston Foundation. They are the foundation that supports KGH, Hotel Dieu, Providence Care, our 3 main hospitals, Providence Manor as well, benefiting from them. So that is why we're doing that here today.
We had that quote where it was like, the project will either cost $500 million or $1 billion. Imagine having to weigh, I hope we don't go a little over, so it's $1 billion. But obviously the work that they do is so important, and we've realized that over the past few months. If you didn't know it already, you do now about our incredible healthcare team here in Kingston. And they are obviously in need in some cases of whether it's a new facility or a new equipment inside. Your donation is going a long way to make that happen.
Yeah, and that $500 million to $1 billion project is the redevelopment center or the redevelopment project or the tower that you always hear references to. The tower it's supposed to be like 12 stories tall, and you know, if you look around on the hospital's website, you'll see, like, you know, images, pictures where you'll see what the emergency room looks like right now and what it's going to look like in the future. And man, they've got you know, a whole setup in place, a whole plan in place to have more beds and have this thing looking amazing to make sure that you know, we're all getting the best healthcare that we can. And we can't stress it enough, and it keeps getting said time and time again, but the government only provides 90% of those funds. That's building funds. And then the other 10% plus what goes into these buildings has to be raised by the community. So hence the Stream-a-Thon. Ready for some live music?
I am.
All right. Well, Brittany was talking to him earlier before. We mentioned how he's not only a radio announcer. Interesting. He country superstar first,
Yeah.
and then gets into radio afterwards. So we're going to just do things the other way around, right? We'll get into the professional artist side of things after the radio.
Yes, that's how it's going to work. We got to wait
anyway,
for some demand first, and then.
Well, that's true too.
Yeah. Nobody wants that right now. We got to wait.
Anyway, we were talking about Jason Mccoy, who, yes, is also part of our team at Pure Country, and he is going to perform "We Are One." So big thanks to Jason Mccoy for being part of the Stream-a-Thon here today.
World of worry, world of change, world of lives rearranged, joined together in song. We are one, we are one. We have doubts, we have fears, we share the hurt, we share the tears. We are here, we're not alone. We are one, we are one, we are one, we are one. Yeah, the miles may divide us, all the love will unite us. We will rise and overcome. We are one, we are one, we are one, we are one. One love, one fight, one heart, one life, underneath one sun. Take a stand and be still across the land. We will win, this will be done. We are one, we are one, we are one, we are one. Do your part, ease the pain. Stay apart, we gotta break the chain. Yeah, we'll join hands when freedom comes. We are one. We
That once again is Jason McCoy. We are one part of our Stream-a-Thon here with 98.3 Fly FM. Very thankful to have Jason spend some of his time with us and talk about the need and the importance of our healthcare workers, because we've said it time and time again.
You all right over there?
Yeah. Can you hear me? Check, check.
Oh yeah, I can. Everything's fine.
Okay, I thought maybe I was getting word from our producer. I keep referring to our producer that was saying maybe my mic wasn't on, but yeah, we've mentioned it time and time again, and we've noticed it so much more since COVID-19. But just the how important our healthcare workers are and the fantastic work that they do. So this is this is a sort of a twofold sort of thing with this Stream-a-Thon. Yes, we want to raise a lot of money for the foundation to, be able to do these projects, but we also want to send a big thanks to them and for all the hard work that they do as well. So kudos to them. And yeah, let's just keep supporting our healthcare workers and raising money for the foundation.
Yeah, head over to 98.3flyfm.com. You'll find the link there. Where you can offer your support for the University Hospitals Kingston Foundation. And again, those donations today are being matched up to $25,000 by the International Brotherhood of Electrical Workers, Local 115. So a big thank you to them. And if you're wondering, hey, why today? Why is today an important one to make that donation and offer your support? It's because you donate, say, $20, $40, it immediately becomes 40 and 80.
That's correct.
Yeah. You looked like you were deep in thought. I didn't want to interrupt that. Very pensive.
I was questioning the math there. I'm like, wait, yeah, no, I think he's got that right. So yeah, we're going to be hearing from more doctors and more guests coming up in a little bit.
Reed's gonna be doing less math.
Well, I'll tell you what, at some point, maybe we're going to be doing something in the form of a challenge, because as we like to do, when we've done like our blood drive, for example, in the past, we said, if we reach a certain amount of goal, we like to make things interesting, to say the least. So on our Facebook page, we have said, if we can reach $25,000 today, that we would do something crazy. How do you feel about eating a scorpion?
Is that legal?
Not sure. Not sure.
I also don't know where we would just round up a scorpion.
Yeah, now I would hope that something unfortunate would have happened to the scorpion ahead of time, and then it was just sitting there, and we would no, I don't know.
No.
Let's just pass on that one. There's also suggestions for us to perhaps do like some type of busking, a busking act, assuming that we have some hidden talents from childhood that could provide us with bring that out and do some kind of busking. But
no, we have no hidden talents. Our measly talents you see, you hear every day on Fly FM. That is it. That's the most we can do. Yeah.
Talking about the hospitals, I don't know, Ben, if you have any experiences at all along the way that you could share. I feel like I'm fortunate enough where I haven't had to, knock on wood, use too much of the services that we have here in Kingston when it comes to hospitals. But 2 of my 3 children were born at KGH, and you can never just say enough about the care. I know that we were just treated like gold when we were in there, and you just knew you were in the best hands while you were at the hospitals.
Yeah, I mean, my daughter was born there. My daughter also has had a broken wrist before, so we turned around and went back in there. And even just from having lived in Kingston for long enough, you come to know local healthcare workers just through friends, or they become friends. And really, once you see the amount of work that they're doing day to day, the incredible attitude that they have about the work that they do throughout the day is an amazing thing. So I salute all of them. And any experience that I've ever had using healthcare here in Kingston has been fabulous. I'm always amazed by the level of service and the different services that are offered here for a town Kingston size. It's incredible.
Yeah, I mean, that's true as well for the size and population that we have in here. We got some of the best doctors and the best care and some of the best equipment, but some of it, as we heard earlier from Krista Wells-Pierce, she was telling us about how some of these buildings, were built in 1940 or they were built in 1950, and they've run their course a little bit, which is why this redevelopment center that is planned is much needed, where we can just make things get even better from there. So that's going to be an expensive one for sure. And so if you can, first of all, thanks for checking out the Stream-a-Thon. We're going to be talking with more doctors and specialists throughout the next couple of hours. But if you can, just click on the donate button, and whether it's just $20 or whatever you can spare, we really appreciate it. And we can't thank the International Brotherhood of Electrical Workers, Local 115. They're right here in Kingston, by the way, for matching up to $25,000. And we have word as well that we got more entertainment coming our way as well. Brittany, who is our boss and works as well on air over at Pure Country 99, has been talking with country artists throughout this Stream-a-Thon, and Brittany has George Canyon with her right now. So we will throw to Brittany and her chat with George Canyon on the Stream-a-Thon.
Welcome, George Canyon, to the Stream-a-Thon for the University Hospitals Kingston Foundation. We are so excited to have you be a part of this with us.
Thank you. I'm excited to be a part. I love Kingston, of course, and such a great cause.
And the great thing with you is you're such a recognizable name, whether it's with country fans and I think just music lovers in general. Like if you say George Canyon in Canada, people know who you're talking about. So that was really exciting for us because this is also a partnership with our other station, Fly FM. So we knew that we had enough star power with your name that we're going to get attention on both sides.
Well, sometimes people only know me as from the NHL as the anthem singer for the Calgary Flames. It's kind of fun.
Well, there you go. Yeah, I think there's a lot of things throughout the years that you've been involved in that I would think there's very few Canadians that aren't familiar with who George Canyon is.
Well, I turned 50 this year. I've had a 30-year career, so there's been lots of time.
Well, we're really excited to have you here. You have a lot to talk about. I know you have a new single, you have a podcast, and it's also nice too because you have been such a person in the front when it comes to healthcare and especially causes for diabetes, and this being a hospital Stream-a-Thon, who better to be able to speak on behalf of just the importance of healthcare in general, but the sector that you've really given your attention to over the years as well.
Well, I was going to be a doctor, and a few people know that.
You still might be. I mean, you've had a lot of stuff.
Maybe. I did my pre-med on the way to Dalhousie Medical School, and I went on the road with a band. But as a type 1 diabetic of 36 years, I really see how important healthcare is as a firsthand basis, a daily basis. And we need to definitely, everybody needs to be putting a lot more effort into healthcare in Canada. I've got buddies who live down in the States and like, oh my God, your healthcare is amazing up there. But yet I hear story after story of people where the healthcare system is failing them, and they're Canadians. And you should never be hearing those stories. So we all need to come together and work diligently and work hard, have fundraisers, not unlike this, where we can definitely make certain the funding is there, and then we can also make certain that the personnel is there as well.
And I think that's one of the misconceptions is people think that everything to do with healthcare is completely government funded, but pretty much everything inside of the hospital isn't. It's relying on community donations. And after being hit so hard with COVID-19, I know that has had an impact on literally every aspect of everybody's life, including our local hospitals here. So very appreciative of your time to be able to help us out with this cause.
Oh, I love helping out where I can. I just interviewed a nurse, and I think, actually, was she in Kingston? I'm not quite certain, but on the podcast, she's a type 1 diabetic who is on the front line and actually did get COVID. And God love her, she's right there on the front line. She got through COVID and did the quarantine thing, and then she's right back out there working on the front line again. And
wow.
Really value our healthcare employees, all the levels, right? You know, doctors, nurses, cleaning staff, all the cafeteria. I mean, there's so many elements. And when I worked in a hospital, when I was going to university, when I was doing my pre-med, I worked in maintenance, and I get to really have a different, I get to see a different side of it. And it's incredible pieces, all these little pieces come together to make a hospital successful. And this is, you know, you might not be working at the hospital, but this is an opportunity where you can be a little piece to help the hospital become successful by helping the fundraiser.
And I think that's something that we've become so aware of in the last few months, is how everybody's role plays a piece in everybody's life, like whether it's hospital staff, people just working in the building, people in the community, people who can donate, musicians who can help out with their star power. So this is really great. And you mentioned your podcast, and I'd like to talk a little bit about that. As we had mentioned, that you've been right in the forefront with diabetic research and education and helping people. And now you actually have a podcast.
Yeah.
If you could give us just a little quick summary of how that is, what you're doing with it, and you know why you decided to start it, because I know you have a lot of things on the go.
Yeah, as a type 1 diabetic of 36 years, I've worked with children and families with type 1 diabetes over the last almost 20 years now. National spokesman for the JDRF, a vital organization that we all depend on and daily for the work that they do. I wanted to do a podcast for a long time, and this gave me the opportunity to kind of get it started, to get off my lazy butt, get it done. And we've had a wonderful time. We've had incredible guests. I'm on a Dexcom G6 CGM and an Omnipod insulin pump, and we've been able to interview some of those people talking about technology and what's coming. And then I've been able to interviewed a kid the other day, you know, not all heroes wear capes is what the episode is called. And she's just a sweetheart of a little girl. And she got an award from school, and just encouraging children living with type 1 diabetes to live their dreams like I get to. And the podcast really gives it that platform, gives us ability to talk to everybody all at once. And we call it Life as a Diabetic, the highs and the lows, no pun intended.
And I think that's something that a lot of people don't thoroughly understand. Like, you hear of diabetes, you know of somebody with diabetes, but my nephew has it. And it wasn't until he was diagnosed with it that you realize the magnitude that has on a lifestyle and what you have to do. But you see people like yourself and people like him who, you know, you make it look easy, but there's so much that goes into it, and you rely on, you know, technology and healthcare and so many pieces to be able to just seemingly live a very comfortable, normal life.
It is. And in fact, I challenge all the kids I talk with that when people tell them that they can't do something because they're a type 1 diabetic, I say, well, this is true. I was told that. I was told I'd never be a pilot. I've been a pilot for 14 years now. We work diligently with Transport Canada to gently convince them. And now, as a type 1 diabetic, you can become a commercial airline pilot, where before you basically, like one of the guys who was involved, Steve Steele, he was a commercial pilot, got type 1 diabetes. They took away his license. He came back and fought for the right to get his license back. But if you were a type 1 diabetic before a commercial airline pilot's license, you weren't allowed. And now Canada's leading the world with our very first commercial airline pilot, Austin McDonald, who's a buddy of mine, just a great kid, a hard worker, determined, type 1 diabetic, him and his dad. And I actually was on his first flight. That's exciting. And we have him on one of the podcasts, so you can actually go and listen.
That's really cool. And I know that you were very much involved with that process, because I remember when that actually became a thing.
Yeah,
and you were right there with it. At least you're using it for good, though. So.
Oh yeah.
And that kind of comes back too with the Stream-a-Thon. What we're raising money for is not just the equipment and the things inside of the hospital, but the research and all the pieces that go into being able to even have the data and the science behind being able to go and get things like that changed. Because without the data and the research, I mean, it's very hard to convince people to change their ways.
Unless you walk a mile in someone's shoes, you're not going to really have that much empathy. But if you have the data that says, look, this is what's going on, this is the proof, it helps the process for sure.
Yeah, and that's all a very expensive process. So you just released a new single called Speed of Life, and I enjoy the title and the message of that song, when life has seemingly come to a complete halt. So I'm sure over the last few months, you've been able to sit and reflect and think about how fast and how many things have happened in life. Was the song obviously was not to coincide with COVID-19. It's just, I'm assuming, kind of happened that you have some time to reflect on life now.
Yeah, I have for a while though. I turned 50 this August, which for me is still hard to believe. I've had 30 years in the business, but I've reflected back on my life for quite a while now, and just how when you're a kid, like, how old are you?
31.
Okay, so you kind of get to that point where you get to your 30s and you're like, okay, I'm ready. I wish I would have slowed myself down and stopped wishing away the time when I was 13, 16, 21, then made it to 30. Turning 50, I look back and especially with my children who are 21, 20, and 20, and I'm like, oh my gosh, I wish I could turn back time and then slow it down and just really breathe in every moment. We're all guilty of wanting to achieve and accomplish things, and the speed of life reminds me, even now, reminds me to take a moment and breathe in what I'm experiencing, and it's helped a lot. I mean, of course, I'm doing it to myself too, but the song has really helped gently remind me.
Yeah, and we are actually going to hear a performance of that song at the very end of the Stream-a-Thon. So we're going to wrap up the whole thing with a great performance of that new single. Now, I am old enough to remember being in the crowd in Nova Scotia in, I think, 2004, when you were there for the hometown show for Nashville Star. That is going back quite a few years. So to think of all the life that has been lived within even just that time frame is pretty remarkable.
It is, and
I had a George Canyon sign.
How old were you then?
Oh my goodness! Well, I'm 31 now, so
God. So
my mental math is not good. In 2004, I think it was probably. Yeah, so I was little.
Yeah, little. And looking back on all that time, especially, I wish I would have. In fact, I just passed on a message to Kissel, to Brett the other day, because I've known Brett since he was a kid, and I told Jim to tell him, take a moment, take a breath, enjoy where you're at, and just constantly, because as you know, athletes and musicians, artists, you want to constantly work to achieve, and sometimes you just got to take a moment and go, wow, this is awesome, look what's happening around me. And I wish I would have done that more after Nashville Star, but you work so hard, and then you think, oh my gosh, if I don't keep working hard, it's all going to fall apart. So you keep doing that, and you sometimes forget to smell the roses, I guess.
Yeah. And I think maybe that is a bit of the silver lining of the pandemic and just bringing everything to a screeching halt, is that I think everybody was forced into that place where you just reflect and you think and you reevaluate what's important and you know what needs your attention and what doesn't. So I guess if there is a benefit to all of this, then that might be it. But now going forward, we have to pull ourselves back together and get things back to the new normal.
Figure out our industry, our new industry online. It's at least till 2020.
Well, at least we have technology. Yeah,
that's the beautiful thing. We've been able to do shows on Sundays for 10 weeks, able to, you know, at least try to help the fans get through it with us. And thank God for technology, because if this happened 30 years ago, let's just look at it.
Yeah. Oh my goodness.
A completely different pandemic.
Yeah, we would have been all on a party line.
Get the news out to everyone, and then, you know, that's the thing with, at least with social media, where everyone can get their news right away. Yeah. Hopefully it's true, because there are some BSers out there. It did help feel like we were all united, and a buddy of mine said it perfectly. He said, we're all standing in the poop up to our ankles together, so nobody splash.
And technology too, of course, has made it very easy for things like this to be able to call on some of our country music friends to rally together for our communities. And it's super easy and it's so easy right now too, because as you're watching the stream, little link right there, you can donate, and you know, you're getting some entertainment, you're also doing a good cause, and you're sitting at home. So what more could you ask for?
I always say, it doesn't matter if you're giving $1. What you think might be the smallest of donation will add up. All those donations add up. So donate what you can.
And we are very happy too, because we actually have a partner who will match up to $25,000. So
Oh, wow.
if you're donating 20, it's going to multiply to 40. So
That's fantastic.
very, very excited about that. So we will get back to your performance in just a few minutes, but I want to say a big thank you for taking time to do this. It means a lot to us and to our community, because if we can't get a George Canyon concert in Kingston, at least you're here via technology.
Well, we miss everybody in Kingston, and we will be back. And when we come to play a live show, we are going to have one heck of a kitchen party. So that's what
Oh, it's going to be, yeah, I'm a Maritimer, so I'll be right there in the front row. I'll bring my spoons.
It'll be a 3-hour show. Look out.
Thank you so much.
Thank you.
Thanks, Brittany, and thanks to George Canyon once again. What a guy, chatting it up there with her and being a part of our Stream-a-Thon today. Appreciate him. And yeah, we are going to hear a performance from George Canyon coming up in a little bit. So look forward to
Does that guy have the greatest living room lighting in the history of the world? Did you see that?
It's pretty good stuff.
It looked like a coffee commercial. It was amazing. I was blown away.
Yeah, maybe get a few bucks or something like that. I'm not sure. All right. So, yeah, we're happy to have you part of our Stream-a-Thon here. This is to raise money for University Hospital's Kingston Foundation. We're 2 hours in now. We got a couple of hours to go. And yeah, you can click right on our website. It's the Stream-a is at our website, 983flyfm.com. Also at the University Hospital's Kingston Foundation website. And so we just appreciate you spending a little bit of time with us today, as well as donating money. We want to raise a lot of money for the hospitals and the foundation. We've got our next guest ready to pop in. Yes, okay. He's ready to go, and he's got the title of Department Head for Emergency Medicine for Kingston Health Sciences Center. His name is Dr. David Messenger. There he is. Good morning, Dr. Messenger. Good afternoon.
How's it going? Yeah, afternoon now, isn't it?
Yeah,
we are. Where I'm trying to picture. I guess, are you at the hospital right now?
Yeah, I'm in my office at the hospital.
Tell us a little bit about yourself, where you're from, and you know, how did you become? How did you get this great title of Head of Emergency Medicine?
Yeah, it's one maybe I wouldn't have signed up for if I knew this was going to happen over the last few months. But I've been in Kingston for over 20 years now. I came here as a university student. From the East Coast, where I grew up in Halifax, and have been here since, and did my medical school and emergency medicine training here in Kingston, and started practicing at KHSC a number of years ago, and more recently I've sort of been involved in some administrative work, as well as my clinical practice in Emerge and in ICU. So it's a great job, great place to live and work.
Speaking of the emergency department, can you give us a little glimpse of what that department looked like pre-COVID versus what the situation is now?
In the last few weeks, we've been returning more to the normal that we've been used to as people start becoming a bit more comfortable coming back out in public and going to the hospital again. You know, our emergency department is a busy place. At the KGH site, we saw over 75,000 visits to the emergency department in 2019. And that's been steadily growing in somewhere in the like 7 to 8% per year range. And so over the next 10 years, we're anticipating about a 20 to 25% increase in our total visits at KGH. So that translates into somewhere close to 200 patients a day coming through the doors of the emergency department to get care. During COVID's we'll say the peak of concern in March and April, we saw a real drop in our visits. Which was a bit surprising to us, actually. We sort of expected to see a lot more, but we've been fortunate in our region that there haven't been more cases, and there haven't been a lot of people coming to the hospital with COVID-related illness. And a lot of other people stayed away for better or for worse. And so we were seeing almost 50% of the normal volume of patients we'd see in a day. That's come back up to normal now, which we're happy about because people need to access care and they need to feel comfortable coming to the hospital when they need it. And certainly we saw some evidence over the last few months that people were putting off seeking medical attention for some pretty important conditions because of an apprehension about coming to the hospital. So we're glad that things are back to relative normal now.
Yeah, you want to find that fine balance of don't come to the emergency room for no reason at all, but of course certainly don't stay home either at the same time. Before we get into the plans for the emergency room and beyond, let's talk about the conditions right now in the emergency room at KGH. You mentioned 200 people, when on a regular day, 200 patients coming through the door every day. That sounds like a lot. Maybe expand a little bit on that and the conditions inside the emergency room department.
Yeah, so I think it's important to sort of recognize the role our emergency department plays in the Kingston community, but also in the broader region, right? So we're the only receiving site for ambulances and air ambulances in Kingston, and so we are the primary emergency department for the population of the city and the surrounding region, and we're also the major referral center for the region. We're the level 1 trauma center for Southeastern Ontario, so we see patients being sent here directly for major trauma from all over. We're the stroke center for the region. We're the cardiac center for the region. So we service a really broad area and need to be able to provide really specialized care to a large number of people with often very complicated problems. And we're doing that in a facility that was designed effectively 50 years ago, at a time when the number of people seeking emergency care was very much lower. The population was a younger population. The complexity of illness and the complexity of the treatment people were getting for illness was a lot less. And so we're still operating in a facility that really is not fit for the purpose it now needs to serve. And we've been trying over the last, confined in a fairly small footprint. We've had to take the 35 stretcher spaces that we have and try to create more of those out of hallway spaces and cram patients in wherever we can. As emergency physicians, the thing that worries us the most is having people in our waiting room for long periods of time. And yet, because of confined physical space and challenges in moving people through the emergency department and long stays and limited beds, people sometimes have to wait. So we've been working really hard to try to figure out ways to improve access to care for people who come to the emergency department. But in our current footprint, it's really challenging.
You've touched on a couple of really great points, and they go towards the question that I had about the importance of supporting the University Hospitals Kingston Foundation and why you think that's especially important right now.
Well, yeah, I think it's especially important right now because we have this tremendous opportunity to transform what emergency care can look like and the environment in which it's provided through redevelopment of the hospital. And there's a misconception that the government will fund all of this work, and this massive redevelopment that the hospital is planning is going to be supported entirely from the government. And that's in fact not the case. There's a huge need for community support to help make a redevelopment project like this one a reality. And particularly for things like equipment and furnishings and supplies, those are key areas where community support is really, really important. And we're talking about reconstructing an entirely new emergency department on a new footprint, so it can be a purpose-built space. We're no longer going to have to sort of try to work within the walls that we have, but we're getting a new, completely redesigned, built from the ground up space that will allow us to provide state-of-the-art care. And we're really excited about that. So we need the support of the community to be able to make that vision a reality. And the foundation is the way to help make that happen.
Yeah, the redevelopment project, I guess, has been sort of nicknamed like the tower, if you will. 12 stories, over $500 million is what it's going to cost. And yeah, with the government only providing 90% of that, this is where the community has to come together and put in the other 10%, in addition to all that equipment. And you know, I was looking at some of the pictures of, you know, we talked about what the emergency room kind of looks like right now, and this new redevelopment project, just it looks absolutely amazing. I can imagine it'll just make things run that much more smoothly when it's all said and done.
Well, it will, and it will allow us to create a space that actually meets the needs of the population we see now and the population we expect we're going to be looking after in the years to come. So it gives us unique opportunities to plan around how do we look after aging and frail elderly patients better in the emergency department? How do we make it more accessible? How do we support good infection control practices by not having people as crowded and having more private rooms? How do we reduce noise? How do we provide specialized space to care for people with addiction and mental health concerns? And how do we create a safe environment for kids and for elderly patients? How do we ensure that you know, the facility meets the needs of our patients? And that's what we really are excited about being able to do.
One of the great things that I've noticed about the Kingston Health Sciences Center while all this has been going on is on social media, taking the opportunity to really put faces to the healthcare situation here in Kingston, really getting a look at nurses and healthcare workers of all kinds. What could you say about the job being done by those individuals over the past little while?
I can't speak highly enough about the team of people who are providing healthcare at KHSC. I am so humbled every day coming to work by the commitment and dedication of the people I work with, who are going through all the same challenges that everyone else has in the community right now, and have challenges, you know, figuring out what to do with their kids who aren't in school, and yet still are showing up to work and doing their job, despite a fair bit of anxiety a lot of the time about sort of what the risk to them might be from infection. But people have really pulled together. They've been incredibly adaptable to change. They've done it with a really positive attitude, with a real sense of teamwork and pride in what we can do together. And our community is incredibly lucky because you know, not only are we a community hospital at KHSC, but we're also a major academic center, right? We're training the nurses and the physicians and respiratory therapists and x-ray technicians that will go out from here and serve other communities as well. So because of that, we have a really high level of training and care available for patients who come to our facility. And our team is really, really unique and special, and our community is really fortunate, I think, to have the committed and highly skilled workforce in healthcare that we do.
We are talking with Dr. Messenger, who is the department head for emergency medicine, Kingston Health Sciences Center. We are doing our Stream-a-Thon right up until 2 o'clock this afternoon. We're trying to raise as much money as we possibly can for the University Hospitals Kingston Foundation, and a lot of that money, I guess, I imagine, is going towards this redevelopment of. It's not just the emergency room, emergency department, pardon me, but other parts of KGH as well will all be part of this. And do we have a timeline? How does this whole thing look for you? When's it going to be shovel ready? When are you hoping to have this thing built by?
That's a fantastic question, and it's a bit of a moving target. And of course, with the pandemic and the changes over the last few months, there's been more uncertainty around when exactly shovels will go in the ground. It's a huge project that involves a number of stages, including taking down some of the existing buildings to create space and relocating offices, and then starting construction of the new tower. We have the advantage as the emergency department that we're the ground floor. So we'll potentially be the first space in the new tower to be able to open. So we're excited about that. And my hope is that that's a timeline that, if we're lucky, within the next 7 or 8 years is going to be a reality. But again, there's a lot of uncertainty around that right now.
It's still going to be done before the. It'll still be done before the third crossing, though. Can we make third crossing jokes still? Is that? Can we get on their case? Is that allowed?
Well, yeah. There's got to be there. It can't be a Kingston conversation if they're to talk about the third crossing.
Exactly. It's got to come up at some point.
Dr. Messenger, thanks so much for your time today and shedding a little bit of light of what the scene is like in our emergency department, and stressing once again the importance of what the University Hospitals Kingston Foundation does. And as Ben alluded to when talking about the social media posts and thanking our healthcare workers here in the city. We just like to echo that as well. We can't thank you guys enough for keeping us safe and being those frontline workers and doing what you do, and then especially over the past few months.
Yeah, well, we're really grateful for all the support we've had from the community during this time. It's been really humbling and really gratifying for our spirits and our morale, and helping us know that we're doing what we need to do. And we're incredibly grateful for the support of the community and helping make redevelopment of the hospital a reality. And supporting the UHKF is a really important way to show support for healthcare.
Thanks for your time. Have a great day.
Thanks, you too. Thanks for chatting with me.
Dr. Messenger, Department Head for Emergency Medicine, Kingston Health Sciences Center, and part of our Stream-a-Thon today, which we are going to continue to do right up until 2 o'clock this afternoon. We thank you for those who have joined us already, and those who have donated already as well. We're getting match donations right up until $25,000 from the International Brotherhood of Electrical Workers, Local 115. So that is fantastic. We can't thank them enough. And it's been pretty great so far, getting the perspective from the doctors and the people that are in there day in, day out, working those long hours at Kingston Health Sciences Center.
I'm going to ask you a knock on wood question. That is, have you ever broken anything before?
So, knock on wood.
Yes.
No, I have not.
Really?
I have not broken anything. So the streak continues, and just talking about it right now, I feel like you're just jinxing me.
I know.
But I will tell you though that the closest I ever came, I think I was like 15, and I was skiing. This is when I was growing up in Montreal, and I went skiing, and I had a fall, and I landed on my hand and kind of messed up my thumb a little bit, and went to see the doctor there and said the thumb wasn't broken. So my thumb was not officially broken, but some ligaments were torn or whatever, and it was kind of damaged. I remember the doctor saying, you could wear a cast if you want, but you don't necessarily need to. And I opted for the cast just because I felt like, I don't know, I've never broken anything before. Maybe this will give me a sort of feeling of what it's like wearing the cast. So I opted for the cast and wore the cast for a little bit. And but no, nothing was ever broken, but I have worn a cast.
I'm just picturing you going through the school halls like, ladies. Huh?
Exactly, yeah. Sign here, somebody. I just wanted to get the all right, we have got our next guest ready to go on our Stream-a-Thon for University Hospitals Kingston Foundation. She is the operational director of the Women and Children's Programs at KHSC. Her name is Stacy Wolfram. Morning, Stacy. Or good afternoon. I keep saying good morning. Probably because we do a morning show normally and we're not used to being up this late. Hi, Stacy.
True.
Hello, how are you?
Ah, there she is.
Ah, there we go.
We're good. We're starting to get a little giddy because we're sharing stories of me not really breaking my thumb but still wearing a cast. Anyway,
I was always jealous of other people's casts.
Yeah, it was same. That's what it was. I think. Have you ever broken anything before?
Never. No signatures on my arms or legs.
Huh.
So this is what Stacey, knock on wood as well.
Okay,
Yeah.
I'm knocking.
We're jinxing it all.
Where are you coming to us from currently right now?
I'm in my office at Kingston General Hospital, and I have a beautiful view of the water today, so I'm enjoying that.
Oh, very nice. So did I pronounce your name properly? Is it Wolfram?
Wolfram, that's it.
Operational Director of Women and Children's Programs at Kingston Health Sciences Center. Well, thanks for joining us on the Stream-a-Thon. Maybe tell us a little bit about yourself, your title, and like I've been asking all our guests who have been joining us, just a little bit about who you are and the work that you do in town.
That's great. Thank you for having me. So yeah, my name is Stacy Wolfram, good pronunciation, and I've been the operational director here at KHSC for the last 3 years in women and children's health. And so I actually started my career as a social worker, and it's taken some twists and turns, and here I am 20 years later. And so I've had the opportunity for the last 3 years to be working with obstetrics, gynecology, the neonatal intensive care, and pediatrics. And so that's at both the Kingston General site and as well as the Hotel Geo site with their COPC there. So I'm excited to talk about redevelopment today because you can see on the back of my door, that's the floor plan of the new version. And actually, this is like my dream state. Sometimes I just stare at it and dream of that day. So I'm excited.
And well, tell us what in yellow, is that yours?
So actually, the whole thing is mine. So I'm
nice.
Yeah, that's why I'm so excited. Yeah. So the kind of the light green over there. So that is actually going to be our new neonatal intensive care unit. It's currently about this big over here. And so you can see that it's going to grow by almost 300%. And then this yellow area here will be our new pediatric floor. This here will be my new postpartum floors and post-surgical for gynecology. And so this here is my new labor and delivery floor.
If you ever feel like going into like a weather person career, I think you could do like a
Is that my next calling?
Because you're great at the pointing to things that are behind you. You mentioned the neonatal intensive care unit. Tell us a little bit about what that will look like with the redevelopment versus what it looks like right now.
So I'll start with current state. So right now we can house up to 24 isolates, sometimes called incubators, and that puts us in a very crowded spot. So we have right now what's called an open bay model. So we have 5 nurseries, but really it's one giant open space that we've kind of sectioned off to call different nurseries, A, B, C, D, and E, and varying levels of care throughout those different spaces. And so right now it's very, very crowded. We have literally sometimes just a few feet between each of the isolates, and parents crowding around their obviously right now not too much crowding with COVID, but generally speaking, we have people crowding around the isolates trying to have the nurses provide care with the parents there. So it's a very intimate space, let's say, and not very comfortable. And so redevelopment is going to offer us state-of-the-art facility. So every isolate will have its own private room. And so what that means is that a parent or caregiver, loved one, can actually sleep in that room. They don't have to ever leave the bedside of their baby because they'll have a private space that they can be in. And if you think about spending days, weeks, or months sitting in a chair beside... Can you still hear me? We've got a code going on.
Yeah. Is that we can hear you, but
you can hear me. Okay, I can't hear you, but okay, there we go. It's over. It's over now.
Okay.
So hospital life.
Just tell us if you have to go in a hurry.
It's not my
Spring
code,
into
so
action.
we
Okay.
should be good.
All right, good.
So basically, what this is going to do is this is going to provide us with space that we can co-design with patients, with families. Obviously not the babies, but the families, and really create a space that's comfortable, because we want parents to be in this environment. We want them to be comfortable. And right now they're either in a chair beside the isolette or they're standing beside it. And so, as you can imagine, that's a pretty awkward place to be for up to months at a time.
Yeah, I mean, I had no idea that the situation was like this, especially when you're talking about a relatively serious situation. Obviously, frightening situation too if you're a first-time parents and you know your baby is born premature, and then I would imagine even for parents they must be kind of surprised to find that when they arrive at the NICU that they don't actually already have their own space. That's the situation right now.
Absolutely, yeah.
So this new NICU unit, as you mentioned, is going to change all of that, and it'll have like a more space, and obviously private rooms for all the patients coming in. Because I was surprised to read there are 400 newborns that are helped in NICU each year. That sounds like a lot.
Yeah, so we have on average 400 admissions per year. And so some of those babes are only with us for a few hours, some are with us for a few months. And so it really depends on at what stage of birth they're in their gestational age of they're born, and how critically ill they are, and what kind of care they need. And so sometimes they just need a few hours of monitoring before they can go back out onto our postpartum floor and be reunited with their mom. And sometimes they need obviously a whole lot more than that. So this new environment is going to, like I said, it'll have built-in space for parents to sleep in the same room as their baby, so that they can have that environment. There will be a family lounge with a kitchenette. There will be there's going to be shared space on the floor, that people can do laundry if they need to. There will be parent showers if they want to make use of that. So it's going to be a completely different experience for families coming into here, which is just totally opposite of what it is right now.
Absolutely.
We are speaking with Stacy Wolfram, the operational director of the Women and Children's Programs at Kingston Health Sciences Center. Maybe speak a little bit to the University Hospitals Kingston Foundation and why you feel that it's so important to offer it your support.
I can't speak enough about what UHKF has done for us, and the way that our community has partnered with University Hospitals Kingston Foundation. The unrestricted donations that we get allow us to mobilize whatever resources we need in order to purchase the equipment that we need to support our staff with certain educational needs. As you can imagine, the care required for critically ill, very premature neonates is very specialized and requires specialized and very expensive equipment and very specialized training, and all of that costs a lot of money. And so there's a perception that all of healthcare is ministry funded, and although certainly our core operations are funded by the government, there is a great deal that is not. And so all of the equipment needs that we have, we completely rely on not 100%, but we greatly rely on donations from our community. And so we work really closely with UHKF to help make that happen, and so that we can buy the equipment that we need when needs arise.
Stacy, so the NICU is one part of the redevelopment center. You're pointing to your plans back there behind you. Maybe talk about some of the other things that the project has that'll benefit the other areas that you're excited about.
Sure. So within my own program, I mean, we have a new emergency department, new operating rooms, but I won't get into all of that. Specifically to my program here, the core message to all of this redevelopment really is that it is going to give us space for families and patients to be comfortable. So, for example, when a mother has just given birth, she's not necessarily guaranteed a private room, whereas in redevelopment, all of the postpartum rooms and all of the post-surgical rooms will be private. And so that's going to allow, obviously, for more families to come and visit, to make that a comfortable environment, because right now we're working with a very old building, old infrastructure, and it wasn't designed with the intent of having family members involved, because at that point in time it wasn't really a thing. And so as care has evolved, the building has not. And so this allows us to have markedly more space. It also, on my labor and delivery floor up here, my operating, I'm really excited about this actually.
You're really good at it. It's amazing.
So I'll have almost 3 times the size in my operating rooms, and on my operating rooms, the reason why it's important for us to have that is because if there is a woman in distress while she's giving birth and she needs an immediate C-section, we need to be able to urgently take her into the operating room. So that's why we have 2 operating rooms dedicated to the labor and delivery floor. And between those 2 operating rooms, we're going to have a brand new resuscitation bay for the baby. So if the baby is also in distress, the neonatal intensive care team will have a large convenient space to stabilize that baby. Right now, their space is extremely small, and so if you have a set of twins, it's very difficult for the teams to kind of jostle each other and work around one another to provide care. So the flow of care and the impact to the patients and the families is going to be completely revitalized.
I would imagine as well, just from a safety point of view, this will be a very important part of the plans moving forward as well.
Absolutely. I mean, specifically to our neonatal intensive care unit, we have one of the things that you want to provide is a quiet environment, because that mimics the in utero experience that the child would have had if they had stayed till full gestation. And so that's really challenging to do with this open bay model with 24 bassinets plus all of the caregivers, the families all around. So we tried to keep things quiet, but that's harder to do. So this is going to allow us to do that. Infection control standards, when you have lots of people crowded into a small space, obviously that gets more challenging. And we all know how important that is, especially these days. So we work very hard at those things, but we will have to work less hard to accomplish the same thing in the future, just making that a safer environment.
Go ahead, Ben.
I was just going to say, and this would probably, I would assume, not only affect Kingston, the city itself, but this would be, this part of the hospital is something that I imagine gets used by surrounding areas as well.
Yeah, that's a really great point. I think one of the things that people are surprised by is the level of care that we do offer here in Kingston. And so we are one of 5 communities in the province that offers level 3 neonatal care. And so that's the highest level of neonatal care that it's graded on 3 levels, and so we offer the highest level, and so we are the center that takes from the region as well. So if there's a baby within this region, they certainly do come to Kingston, and we frequently transfer babies from all over the place. And one of the things that we often hear is how surprised people are that they didn't have to be transported to Ottawa or Toronto to receive their care, and how much they appreciate being able to still have community that's close by and family and friends that are close by and not have to drive too far to get to their homes. So it's a great it's just great that we can provide that care here in Kingston.
I've just noticed I look like I'm frozen on my video. Have I been frozen to you guys this whole time?
No, I'm seeing you.
You look great.
I'm moving around. Okay, every time I look Every time
Watching
I
you
see
wave your arms around, it's a whole thing. Yeah, there you go.
Every time I see my my picture in the on the video screen, I'm like frozen there, and I'm like, do I look? Am I just look like I'm just super still to you guys?
You're fine.
That's good to know. It's our first time doing a stream-a-thon. I don't know. But have you done a stream-a-thon before?
I have never. I have to admit, I was a little curious how this is going to go, but it actually is working pretty well.
Yeah, it's just a big giant Zoom-a-thon.
Exactly. Something we're all getting used to.
Yeah, exactly. Well, anyway, I really appreciate your time here this morning and joining us on our, like I say, first ever Stream-a-thon, and just helping us shed a little bit of light on what goes on, certainly with your perspective to the neonatal intensive care unit, and so telling us a little bit about the project and what the current situation is. Certainly, I had no idea that was the scene over at KGH, and it sounds like, it may be a few years down the line, but sounds like some good things are ahead, which is why the importance of fundraising for University Hospitals Kingston Foundation. So it's been great to chat with you this morning, and soon you'll be able to take down those plans in the back there and actually have that come to fruition and have the dream come true.
Well, I appreciate your time. Thank you so much for having me.
All right, have a great day.
You too. Bye-bye.
That is Stacy Wolfram, Operational Director of the Women and Children's Programs at Kingston Health Sciences Center. All right, well, we're going up until 2 o'clock, Stream-a-thon. Thanks for joining us, and continue to help donate. We've been talking about the importance of University Hospitals Kingston Foundation, so you can go to our website, 983flyfm.com, and you can donate right there. We've tried to make it as convenient as possible for you, and we can't thank the International Brotherhood of Electrical Workers, Local 115, for their generous support as well.
Yeah, they are matching donations today up until $25,000. So essentially, any support that you're able to offer during the Stream-a-thon will be doubled by the Brotherhood, which is an amazing gift, and one that we would love to take advantage of as much as possible, because it's supporting such a great local cause.
Yeah. So we've been getting, yes, I concur, man. This is the point of the show where we start to run out of words, because we've been.
Is that what it is? All right.
So how about we let somebody else do a little bit of talking and singing, actually, as a matter of fact. 93 Fly FM, along with our sister station, Pure Country 99, putting this thing on, and we're happy to be joined by another artist. She's an up-and-comer. Her name is Mackenzie Porter, and Mackenzie Porter is part of our Stream-a-thon. So we'll shift it over to Mackenzie right now on the Stream-a-thon.
Where am I? There we go. Hi.
Good to see you. You look beautiful.
It is good to see you too. Thank you so much for being a part of our Stream-a-thon for UHKF. It's a hospital foundation fundraiser, and we are so excited to have some star power join us.
Hey, I'm super excited too.
And we are so happy because you were actually going to do a performance to open up this. So I'm just going to shut my camera off so I'm not awkwardly taking half of the screen. So you were going to perform, if I'm correct, your latest single, Seeing Other People, which is one of my absolute favorites. So I will just disappear into the world of the internet here and allow you to take the full screen for your performance.
Awesome. Thank you so much. All right. So this is Jake. This is my fiance. Hello. And yeah, like Brittany said, we're going to do my single, Seeing Other People. So 1, 2, 3, 4.
But I
the awkward one-person woo.
I know. Hey, that's better. We've done so many like Zoom meetings and there's been like no applause, so I will take one person.
That was so great. I remember when that song first came out, I was thinking, if you are going through a breakup, this song is your literal nightmare. And I mean that in the best way possible.
I know. I feel like maybe you messaged me or something like when it came out, and I was so excited about that. So.
Oh my goodness!
You guys here. It was very nice to.
It was nice to meet you. Thank you for joining. So I have a long, lengthy introduction to get to. So the great thing about this Stream-a-Thon is that it's with Pure Country 99, but it's also with our sister station, 98.3 Fly FM. But the great thing with you is that we are playing you on both stations. And that is because, of course, first and foremost, I'm going to say, you are a country artist. So if we are playing you on Pure Country, but you are our iHeartRadio future star on our pop station.
It's so crazy. Like when they first told me, because this was never my idea to try to, have this song cross over. And when my record label like first told me, I was like, we'll see. Like, it's a country song. And so I was like, we'll see how many like pop stations play it. And I think it's like top 25 already. Like, it is blowing my mind. Thanks to you guys and like that program and supporting it.
Well, and for anyone who is still just getting familiar with you, let's go through this. Over 60 million artist streams, 3 active singles, charting in 2 countries across 4 formats. Also, you are a Canadian artist, the first Canadian artist in over 20 years to celebrate a country pop crossover with These Days, the remix, which we're playing on Fly FM. It was the most added song on Top 40 radio in Canada when it was released. The original version went to #1 on country radio. That followed another #1 that you had just about, I guess it was just over a year ago, in May of 2019 for About You. And it just seems like every time you do something, it's just like this big spectacle, and it's so exciting to watch.
Thank you. It's been like, so I don't know if you know my story, but like I put out this independent record like a long time ago.
Yeah.
And it wasn't very successful. It was fine. But
I loved Rodeo. Rodeo was like one of my favorites.
Really? Okay. Well, okay.
Yeah, yeah.
Thank you for saying that. But when I first started releasing songs, I moved to Nashville, like was in the scene for like 5 years. So I had taken some time off from like releasing music. So I was very, I guess like insecure about releasing music, and never did I think that all of this stuff was going to happen, and like the cool, like all those stats that you read, when you read them, I'm just like, what is so crazy?
It's so exciting though. And in between that, you've also had a great career with acting. I'm sure people are probably watching this right now and being like, no, maybe it's not her music. I recognize her, but I recognize her face. And where would that be from? Because you were in Travelers and Hell on Wheels. And I mean, that's a whole other world of success of its own, to have that paired with your music career. It must be like, when you look back over even like the past 5 years, it must feel kind of surreal to see how much you've been able to pack in.
Yeah. Sometimes I feel like when I'm in the moment of it, I'm always like, this sounds weird, but I'll be like, I need the next thing. I need the next step. Yeah. But when I look back is when I really appreciate it. And I'm like so grateful. And like, I don't know, it's just cool to see it. When you're in the moment, you're just kind of focused on the next task. Yeah. And it's cool to have like a bird's eye view of everything and feel really grateful for it all afterwards.
And you were here in Kingston not too long ago on the Friends Don't Let Friends Tour Alone Tour, the longest tour name in history of tours.
I was like, I don't know who came up with that tour name. I did not. It was a hard one to say.
A hard one to say, and a lot of people on it. So that must have been a pretty cool experience to be able to hit the road with Dean Brody and Dallas Smith and all of those great artists who have been across the country multiple times, to be able to be a part of that and get kind of, that experience of being on the road. I'm sure looking back now, it feels different now that you can't go on tour.
That's like a whole nother thing too, is like, in those moments, you just think, you always kind of think everything in life is just going to always continue. And then all of a sudden something like everything, like the pandemic that we're going through, stops everything. But that tour was literally so fun. And I will say, like, Dallas Smith has helped me out so much in my career already. Like, he really got me signed to my record deal. He introduced me to my producer. He introduced me to my management. I owe that guy a lot. He's just been a really good friend to me. And I really look up to him, respect him. And everyone on that tour is amazing. But Dallas has always been kind of like, I don't know, he's always kind of like had my back.
And that's one of the cool things about Dallas is obviously people recognize him to be an artist himself, but he does a lot behind the scenes, including like running a label and signing new artists, and then taking some people who need, you know, a boost out on the road with him. And if you look at his Instagram and stuff, he's always posting some new artists and their music and songs, you know, being like, oh, I love this track, or like Instagramming his car stereo, saying that he likes a song that's on. So it's really cool to see that, you know, he's able to kind of share that.
He's so
power.
supportive, and like, you know, some people, I feel like when they do nice things, they like post about it or whatever, like they want like the recognition, and he doesn't. He does like so many awesome things that like even band members that I've played with, that he's helped out behind the scenes, like in amazing ways, and there's no like spectacle to it. He's just like the best human.
So you've obviously had some downtime. You are at home in Nashville. This is probably the longest that you've been stationed in one location.
Oh my God.
Now that you're a few months into it, how is it going? Are you adapting to the home life, or are you kind of climbing the walls at this point?
Kind of climbing the walls. I mean, I really miss touring, and I miss being out there, and it feels like my whole world was like go, 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 and then like a sudden stop. And I think everybody's kind of was. But it scares me a little bit because I don't know when like shows, big arena shows and stuff like that are going to start back up again. But I will say, with Jake, and I don't know if you can see my puppy's like behind.
Oh, Willa?
Yeah, she's right here. But like I've gotten so much family time, and I've never had that ever. I mean, him and I have never been home for 2 months like this ever in our entire relationship, and that's been really nice. And we're gonna go visit family, his family in South Carolina tomorrow. I think we're leaving. So it's been kind of nice to like refresh on those things too.
Yeah, and it's nice that now after a few months of that, you can say that, because I think there's some people who are just like, I haven't spent this much time with this one individual, get me away from them.
I know. Well, the first week, because I had been on the road for a long time and he was on the road, the first week when we got home, we were like, whoa, this house is way too small. Like I haven't been with you like locked in a house ever.
Yeah.
And it's just kind of funny. We had to like adjust a little bit. But I do feel like every couple before they get married should have to quarantine together.
Yeah, that's where the true test comes out. What is one of the biggest things that you've learned during this downtime, whether it's about yourself or it's just kind of like a life lesson that you feel like you wouldn't have been exposed to had you not been forced into this isolation?
I think that like my work-life balance was like a little lopsided sometimes. Like I love working, and this to me, like this doesn't feel like work at all.
Yeah.
So I would spend every single hour of the day, either writing songs or in the studio or on the road. And, sometimes I didn't like give my fiance or like my friends the time that I think they all deserve. And so I'm trying to learn that a little bit. And also just like the calmness. I'm not used to that. And I think some like stresses came up because I've never just had like silence really.
Yeah.
And now I'm like too much silence. There's too much silence.
And you had a pretty busy summer planned, and you were kind of coming off of a busy time too, because you were on the road with Chris Lane, which is super cool. He is a label mate of yours, and it must be nice to be able to be on a label that has a lot of up and coming American artists too. Being a Canadian artist, I don't think a lot of times we're exposed to the new side of American artists, but you kind of get to live in the best of both worlds. So what has it been like being able to tour Canada, but then also getting to jump on some of those American tours too?
It's been really cool. I mean, the good thing for me is, Canada has let me like prove myself almost, because I don't think I would. I mean, we're at US radio now because of all the success in Canada, and my label could be like, look, this already went #1 and people love it, and now let's take it here. And so it's been a really good way for me to show success already, I guess. With some people, like, you don't get to prove yourself anywhere first. And also like, I mean, when I come home, it's different. I mean, I get to be on the radio at home a lot more, and people are singing my songs at home too. So the US is all like very new to me, and I'm really excited to get on bigger tours and stuff down the road. But I feel like, you know, a baby artist here still.
Do you still feel like you need to pinch yourself when you can say that you now have number ones to your credit? Because that can be something that people can go their entire career and it just never works out for them to get a number one. And you've had back-to-back so far, and we're crossing our fingers for a third. I mean, it's looking good, but let's not jinx it.
I know. It's so crazy. I mean, I have like my whole team is so good that I do like attribute so much of it to them because they're just awesome, like our whole radio team and everything.
Yeah.
But yeah, it's just crazy. And like, you know, people say the stat of like the Shania Twain thing, and I mean, I don't even feel justified to be in the same sentence as her because she's like my number one.
Yeah.
But it's pretty cool.
That's awesome. I wanted to play a couple of very family-friendly never have I ever questions if you would like to participate. Okay, so never have I ever intentionally hid from somebody in my band.
Hid?
Yeah, like if you're on the road and you just, because I know you have to travel with a lot of guys. There's got to be times where you're just like, I'm just going to quietly hide here.
I've intentionally like been in my bunk and then be like Mackenzie, and I'll just pretend I'm sleeping. I don't have to come out. So yes, I guess I potentially have like hid from them behind the curtain and just pretended I wasn't awake.
And is that difficult to be sometimes the only female on the bus or on the tour or in the room to adapt to that, or do you feel like you've kind of mastered just kind of blending in with the guys?
I think I'm like good at blending in with the guys. I mean, my band is so awesome. Like I don't feel, you know, weird about it or anything. They're super respectful and they're all married, and you know, it's we're all just really good friends.
I also love how I think people have an entirely different vision of what goes on the road. Like they think of like Motley Crue and like bands like that. Not the case.
No, it's so crazy. Like I think back in, I don't know, probably the 80s and even the 90s and stuff, it was like cocaine and like all this stuff. And my band is like 9 o'clock hits and we're like, oh, I'm gonna go to bed. Like I'll have a glass of wine and then I'm like, this is a big party night for me. I'm going to bed.
Yeah, well, you have to be able to do the night after night stuff. I don't know how people do it. I can't do like 2 nights of like staying up late to watch Netflix, let alone being on the road. Never have I ever forgotten the lyrics on stage.
Oh, I definitely have. I'm pretty good at like just mumbling things that kind of like sound like the same syllables kind of, but yes, I've definitely done that. And it's like your heart starts racing, and it's usually like the second verse or something where it has like a lead in and you're like, oh crap, what's the lyric? I gotta sing now, and you just gotta go with it.
At least now fans are catching on to your lyrics, so you could just like turn the mic to them.
Literally, I have done that before. I have.
Never have I ever seriously considered a career change.
No, I've never. I mean, I've always been, I mean, obviously acting was like a thing I did for a while.
Still entertainment. Yeah.
Still entertainment. I'm not like good at anything else. I do love to cook, but I wouldn't want to have that as like a career. But no, I've always just wanted to do this.
Never have I ever accidentally or intentionally just used someone else's toothbrush.
Oh, I have definitely. So gross. I am not like Jake. He would share a toothbrush with me if we forgot it or something. And to me, that's so nasty. So the odd time I thought it was my toothbrush, and like halfway through, I'm like, my toothbrush was blue. This is green. Yeah, so gross. I'm not about it.
I've actually found that because I know a lot of people are like, you know, don't get hung up on the pink is for girls, blue is for boys. But when I get gender neutral toothbrush, like I can't keep it straight.
I know.
So it's definitely happened.
Some people though, like they're like, well, we kiss. What's different with the toothbrush? I'm like,
totally
no, you're
different.
Like scrubbing food out and like black and stuff.
Yeah, not the same. Never have I ever bought something because I saw somebody else either wearing it or using it.
Oh, 100%. That's like what Instagram is, isn't it? Like, I mean, there's so many. You know, like, I mean, I don't do like ads or anything on my page, but what bloggers and stuff like that. I mean, I know they don't even use those products, and I'm still like, I need that.
Gotta use it. Yeah. Do you know what? I asked this because I was thinking about how much I've been wanting to buy your Led Zeppelin sweater, the tie-dye one from, I think it's, Urban. And it's been like pending in my cart for like 3 weeks. And I'm like, just don't buy it just because you saw someone else with it. But I love that sweater and you make it look so cool.
It's so comfy. I wear that way too much. Like I always have to look through my page to make sure I haven't posted too much in it because I'm always in it.
It's the best though. So that was one when I was writing this question, I'm like, yes, because I'm probably going to end up going and buying that.
You should.
Two more. Never have I ever wiped out on stage.
I haven't fully fallen, but on the Friends Don't Let Friends tour, my foot got like, so on the front of the stage, there was these speakers and there was kind of like holes in them and my heel went into the hole and I fell kind of like in towards a group of fans, but they kind of caught me and pushed me back and it almost looked like I was like about to crowd surf or something, but they knew I was tripping, but they were so sweet and like helped me up kind of.
Is that ever in the back of your head, like between trying to keep your lyrics straight, don't trip, and and high heels, and there's a lot of contraptions on the floor of a stage, like is that ever in your head, or do you just walk out on stage and you're just focused on the crowd?
No, it's totally in my head. I mean, I wear a lot of high shoes and I've actually been thinking about like, maybe I shouldn't wear as many just because sometimes it's hard to move, but usually it's like the moments before I go on stage, I'm like, crap, these shoes suck. But they look awesome. But then once I'm on stage, it's like, I don't even know what I think about. It's like, I can't even, the second I get off stage, I can't even remember anything that just happened. It's so much adrenaline.
Yeah. Okay, final one. Never have I ever said something that I instantly regret it to a famous person. Like, have you met somebody and like either fangirled or just said something stupid that you just walk away being like, oh?
I think probably. I don't think I've ever said anything like mean or rude that I've regretted, but I've definitely like acted dorky and like stumbled over my words and probably just didn't act cool. Where I was like, I should have been more cooler than that. So yeah.
Awesome. Well, again, thank you so much for taking part in this. And as I had mentioned, and as you know, it's a hospital foundation fundraiser, and we're trying something new. It's 4 hours, so we're into hour 3 right now. We've had Jason Mccoy so far, the Hunter brothers. We have George Canyon still to come. You are taking part, so it's so nice to be able to call on some of our country music friends to help our city and help the hospitals, because as we know, COVID-19 has not only ruined a lot of our plans, but it definitely has made some healthcare challenges for a lot of people. So to be able to take a few minutes of your time to do this and to share a performance and just to be a part of this, we so appreciate it. And we are so happy to have you on both stations in Kingston. So next time you come to the city, even more people are going to be singing your lyrics and buying tickets to come to your show.
Yes, thank you so much for supporting on both stations and letting me be a part of today, because it is really cool. And there's, obviously all the hospitals are overwhelmed right now. So it's cool that you guys are doing this to help support the community.
Excellent. Well, thank you so much.
Awesome. Thank you.
Bye.
Back to the Stream-a-Thon. Are we still here? Yes, thanks to Mackenzie Porter for being a part of our Stream-a-Thon. Brittany was chatting with her, who's our boss over here at 93 Fly FM and Kingston's Pure Country 99. We're into the last hour of our Stream-a-Thon, Ben, and we are just over, by the way, just over $8,000 has been raised since the start here at 10 o'clock this morning, which is pretty sweet. And we do know that that 8,000 is actually 16,000.
Back.
What are you doing over there?
Nothing. Everything's fine.
I got a big picture of Ben's thumb. This is. As you can see, we got our next guest here, Nicholas. Is it Axis?
Axis, yep.
Nicholas Axis. I've been doing okay on the names. Program Manager, Mental Health and Addiction Services. With us. Good morning to you, Nicholas. How are you?
Good. Thanks, Ben and Reed, for having me on.
We were just listening to that interview with Mackenzie Porter, and they're playing a game of Never Have I Ever. So little did you know that's what we're actually bringing you on here for, is to play Never Have I Ever.
Yeah, it's the whole thing.
One of the interesting ones actually was the when she asked her about the toothbrush. Have you ever used somebody else's toothbrush by accident or on purpose?
I was watching just before I came on. I was just like, oh, no, not me.
No, okay.
I agree with her on that piece around, toothbrushes, they get into food and different things, and it's not like a kiss or something else. So,
yeah. Have you ever used your wife's toothbrush, Reed?
No, the idea of using someone else's toothbrush, even my wife or kids, that and getting a hair in my food are probably two of the kind of the bigger things that gross me out. So
right.
No, I haven't. Why have you?
Oh God, no! Crazy.
So yeah.
Anyway.
Yeah, so we digress. It has been a long, day. We are into our final hour, of our Stream-a-Thon for University Hospitals Kingston Foundation, and so we are trying to raise a lot of money for them. As I mentioned, we're just over $8,000 now, which is great, and that is actually being doubled as well by the International Brotherhood of Electrical Workers, Local 115, and yes, Nicholas Axis, who is the program manager, so mental health and addiction services, social worker as well, diabetes education and management center, KHSC virtual care. You do a lot of things there, Nicholas.
They're keeping me busy these days.
Yeah. Well, I mean, elaborate a little bit on maybe some of your titles, who you are. You're a Kingston guy, or how long you've been in Kingston for? Tell us a little bit about yourself.
I'm originally American. And I'll tell you right now, I'm getting a lot of emails from down south asking, how did you get into Canada again?
Yeah.
I moved here in 2006 and lived in Toronto for 6 years before I moved to Kingston. And I've been here for the last 7 years. I love it here. Have worked at Hotel Du Hospital for the last 8 years. So it's a great place to live. There's such a sense of community around here, like with UHKF and just everybody. We work together in this area. And I have to tell you, having lived in the States and Toronto, I've never worked in an area that comes together like Kingston does. So it's really great to be here.
Tell us a little bit more about the mental health services offered through the hospitals, and maybe I would assume the increase in what you're seeing in usage while everybody's self-isolating.
That's been the big thing, right? So for people that might not know, we're the tertiary level site for mental health and addictions here, right? So we see people who normally can't be seen anywhere else, who are really having significant mental health challenges and addiction challenges. I also manage a detox center up the street at 240 Brock Street. So we really try to provide comprehensive services, mental health, addictions, for people in the community. We're based at Hotel Du Hospital. We really try and make sure that we provide groups, individual treatments. We do a lot of work with different populations like eating disorders or psychosis. We work with our adult program up to the age of 65, sometimes older. And with our child program, sometimes we have kids as young as 1 or 2 that are coming in to see a psychiatrist. So, and you're absolutely right, guys. The COVID has, while in some areas of the hospital, right, they've been able to ramp down or stop clinics or move to doing just follow-ups, mental health has not stopped. If anything, our workload increased. We've actually been able to move everything virtual right at the beginning of COVID. And so what we've been able to do is find new ways of connecting with our patients and our clients. But what we're talking about is when you look at the literature about COVID, we talk about the first wave and the second wave and the third wave. But what they're saying is the fourth wave is going to be mental health and the financial hardships that come with that. When all this is over, the mental health stressors that people have experienced during COVID, the increased anxiety, the increased depression, the increased loneliness, turning to substances to manage when you have to be self-isolated at home, it's really had a big impact on the community. And we've just seen our services go up and up and up.
Yeah, and not only services going up and up and up, but then as you mentioned too, you're having to do it virtually, which obviously is better than nothing, but certainly I would imagine it's not the same, obviously, as if you can have that one-on-one interaction with people who are going through mental health issues.
Absolutely. And I think we've had, initially, I think when COVID first started, right, it was something new and something different, and it was neat to connect with your therapist online. But as the weeks went on, the novelty wore off, right? And what we're noticing now is that while some patients really feel comfortable with virtual care and they like it as an option, and I really do think in the future, it's going to be part of the services that we offer. What we do know is that for a lot of patients, it's not. enough. They need to come in, they need to have that human contact, they need to have the face-to-face meeting. And so that's part of our ramp up plan that Hotel Dieu has started this week in outpatient mental health and addiction services. We're trying to find ways to get those people who really need to come in, who can't use those the electronic services or the virtual services, to make sure that they have the support that they need.
Self-isolation has been such an extreme circumstance, the kind of thing that we haven't seen in our lifetimes. I imagine that for a lot of people, this could be their first run-in with a mental health issue. This may have had such an effect on them that it may be their first time. What would you say to those people that are looking to use your services for the first time?
So I'd say that there's a lot of good stuff that's been put out by a lot of the partner agencies in town. AMHS, the Maltby Center, us, we work collaboratively together, and we try and tell people to educate about mental health, to reduce the stigma of mental health. And you're absolutely right, Ben. You know, sometimes what happens is you have to have this circumstance like COVID that really puts a stressor on you. And that's when the anxiety you never knew you had, or the depression, you know, or the loneliness that comes out of having to be self-isolated, that's suddenly a very different issue to deal with than, say, you know, having a pain or having a headache, and you've been able to maintain your mental health before, but now suddenly you can't. And I think that's been the biggest thing that I've noticed during that. It started a conversation, right? So I would encourage people to, on our website at KHSC, we have a lot of links for services that people can access in the community. We actually started up a telephone service for the patients that end up going to the emergency room. For people under the age of 18, they can connect to one of our counselors to try and kind of bridge them until they could get connected to service. There's also a lot of good things happening in the community. And so I would just tell people to look at the services available to you, look at what's available in the hospitals with our community partners. And if you are in crisis, there's lots of crisis lines in town, and we can make sure that you get connected to the right service.
Yeah, I think we're the one thing that we are definitely learning while this is all going on, that, you know, if you are feeling those feelings, they are completely normal. So many of us are feeling the same way, and this has all been new for everybody. And yeah, there's just times where you're like, oh my gosh, how am I going to get through another day? And good to know that we have these services now. So we're doing this Stream-a-Thon, and this is to help the foundation, University Hospitals Kingston Foundation. So what role do they play in helping with mental health services and the work that you do, Nicholas?
You know, we couldn't do our work without UHKF. I can't stress that enough. UHKF funds recently let us remodel parts of the detoxification center because we had bathrooms that were woefully out of date, security systems that were out of date. They've helped us in the past to get rooms updated and technology. So to give you a good example with COVID, when we moved virtual, I had to purchase webcams, and the whole world wanted webcams. And so the ones I could get, thankfully, we had the funding from UHKF to help us with that. And moving forward, that's one of the big things we're looking at. You know, a lot of times people have this misconception in Ontario that the healthcare is fully funded by the government. And while it is for the positions and for the services, the stuff like the bricks and mortar and the technology and even stuff like chairs. So to give you an example right now with our ramp up, we can't have patients sitting in cloth chairs because that could, right, carry the COVID as a possible avenue for transmission. So I now have to buy chairs in some of my programs that have had these old cloth chairs for 20 years. And so we have to find wipeable, cleanable surfaces. Well, that's not included in my budget. And so that's where UHKF and donors are invaluable to make sure that we have the tools and the office space and the things at our disposal to be able to provide that care to families and patients.
I think that's such an important point because we've been talking to so many people with regard to redevelopment projects, and you hear numbers like $500 million, for example. Not to say that that isn't also a really important thing, but you're also talking about expenses for things like chairs that you have that still requires funding. So, I mean, it really does run the gamut in terms of budget.
For sure. And I mean, to me, I always want to make sure that I ensure that the service is there and that we have the staff there, right? And that's where the government comes in and helps with things. But little things like chairs, webcams, speakers, stuff like that. That's all stuff we have to find a way to be able to purchase, and that's where UHKF is invaluable.
So we're talking with Nicholas Axis, who's the program manager for mental health and addiction services, social worker as well for Diabetes Education and Management Center, KHSC virtual care. So you touched a little bit on it, but we've talked a lot about the virtual care. Like I say, not everyone is comfortable doing things virtually. You sort of touched on it earlier, where we're starting to get back to perhaps having one-on-one care for people with mental health issues, or just generally need somebody to talk to. Can you talk about people that want to have those kind of services? What services are available? Where do I start? Where do I go? How do things? Yeah.
Sure. So we have a number of programs in mental health and addiction services. So we have our child and youth mental health program that runs as young as 0 to 18. We've got some very specific clinics in there, like the Urgent Consult Clinic, that are dealing with kids who are suicidal or homicidal. We have our child and youth eating disorders program. We have our family court clinic that works with CAS and the courts around youth offenders. We've got our general mental health clinic, where that's where we do a bulk of our work. And that's where a lot of the UHKF funding really helps us. For example, right, we used to do groups all the time. And now in this new world, we have to minimize that. But a lot of times we would feed our kids during group, because that's sometimes the only place where they can get a good meal. And so now in the days of COVID, we can't really prepare food. So we have to look at funding for prepackaged meals, right, to make sure that we can still provide that. Because how are you going to go to therapy? How are you going to talk to a counselor if your stomach's rumbling? Right. So that's one example. In our adult program, we have a transitional age youth psychiatrist that works with kids 16 to 24. We've got the intensive transitional treatment program that helps people who are being discharged from the inpatient unit at KGH. We have an adult eating disorders program. We have the Heads Up early psychosis intervention program. That's a good one I want to talk about, because, during this pandemic, I think you both have probably seen the news, right, that the LCBO and the pot stores, the revenues have gone through the roof because people are bored and they're looking for ways to distract themselves. Well, when that happens, if you smoke too much pot or you have the wrong genetics, you can go into a psychosis. And so we've seen an increase in the amount of psychosis presentations and what that means for our program to try and help them. We also have the detox center, right? That's right up the street at 240 Brock Street. And we've had to reduce our capacity there by 50% because we have to maintain physical distancing, but they're still open. All these programs are still going. They're still seeing patients. We're still having wait lists rising because mental health didn't take a break during COVID. And so all these services are still available. They can all be accessed either through your family doctor or through the emergency room. And we've got some really good innovative ways of connecting with people, whether it's virtually, whether it's maybe meeting in a park and having that home visit in a park instead of going to someone's home, or having a connection to someone in the community. Maybe we go to a Timmy's for a session instead of coming to the hospital, while we still maintain physical distancing and wearing our masks. Something to show you real quick. One of the things we've had to do to be innovative is that we've decided to get these face shields, right? Because when you're doing therapy, it's really hard to talk to someone and not be able to see their facial expressions, right? And we know for mental health, that's different than in, say, going to a cardiology appointment or going to a neurology appointment. So we need to be able to see people's faces. So again, just PPE to provide us so we can put it around our face so that patients can see our faces or we can see their faces while we maintain proper PPE with masks and distancing. But that's stuff that you didn't really think of before COVID. And how do we adjust our practice to make sure we keep people safe and also let them keep accessing services?
We still have Ben, or are you losing?
Oh, still here. You froze up for a second there. I wasn't sure if you were just glaring at me, but the screen froze for a minute. Everything's fine now. We're friends again.
Yeah, we were getting props. That was actually pretty neat to see those face masks there. And yeah, certainly you're right. That's another aspect that you don't think about is when you're trying to do therapy and you can't actually see each other's faces or whatever, that can that loses a bit of its value as well. So important point, and yet another reason where the University Hospitals Kingston Foundation provides that kind of money to help support those type of things as well.
For sure. And I mean, that's where it's been really useful to be able to, so for example, getting our residents who come to the detox center, right? We're encouraging them to come in with a mask. If they're not, then we're providing them one with them. And so we also have, For example, at the detox center, we don't allow people to have their mobile phones for confidentiality reasons and to protect the other residents there. We have a payphone. Well, you need a calling card to use the payphone, right? So UHKF has been great by helping us get some calling cards for residents there so they can stay in touch with loved ones while they're staying at the detox center for a withdrawal, but they can still stay connected to their support system. So it's situations like that, stuff you don't really think about until there's an emergency or a pandemic and something happens, and then you realize, wow, that's not something that we realize we have to make sure that we can provide. So that's where UHKF is invaluable to us, and the donors are wonderful. And anytime we talk about mental health, I know that people are very responsive, and it makes me happier to know that stigma is decreasing, right? That we can have open conversations about mental health, that we can talk about anxiety and depression, that we can talk about the difficult topics to make sure people know that they're not alone and that this is something that affects everybody, especially now.
It's 100% perfectly okay. So, well, you know what? That's been fantastic, Nicholas. Really appreciate you joining us on our Stream-a-Thon, and just continuing to show the importance of not only the foundation, but as we're seeing the increase in people coming to see you prior to COVID, and even in younger people too. I mean, I know we didn't touch too much on child and youth, but I know that has increased as well when it comes to mental health issues. So certainly an important topic, and that we'll keep continuing to talk about and keep breaking down the stigma, and keep trying to raise money to help make sure that you guys are able to do the great work that you guys do in our community. So appreciate you joining us here today.
Thank you so much for having me, guys. Appreciate it.
All right, that's thank you. That's Nicholas Axis, who is the Program Manager, Mental Health and Addiction Services and Social Work, Diabetes Education and Management Center, KSHC Virtual Care. As we continue our Stream-a-Thon here, it's Reed and Ben with 98.3 Fly FM, as well as Pure Country 99. We are asking for donations to help support University Hospital's Kingston Foundation, being matched by the International Brotherhood of Electrical Workers, Local 115. And it doesn't matter, any donation, big or small, is really appreciated here today.
Yeah, and I mean, I think that was a great example in the conversation we just had. I mean, you hear the number 25,000 and think, oh, if I'm not able to donate thousands of dollars, then what's the point? But you just heard a great story about how just small donations going towards things like chairs for local mental health conversations, little stuff like that. All of it helps. And as you mentioned, those donations will be doubled up to $25,000.
We are, okay. We are good for our next guest. Check in.
I think we need to have like a cardboard cutout of our boss just next to you, so people know what you're looking over at.
Well, the funny thing is, too, and I'm not going to get into real, but I'm wearing my glasses, obviously, which are for stuff that's up close and reading, and then I got to keep, when she's farther away, I got to see what she's saying to us. But anyway, what she was saying is that our next guest is ready to join us on our Stream-a-Thon. Dr. Rudin, professor of and head of surgery of Queen's University Kingston Health Science Center, and I probably messed up your name. Is it Dr. Rudin? Dr. Rudan?
Rudan.
Oh, Rudan. I knew
Rudan.
it.
That's okay. It's like the Sudan, only with an R.
There we go.
Hey, how you doing, bud?
Not too bad. I commiserate you with the glasses. I'm like that as well. Whenever I can't find them, I look on top of my head.
Yeah, there they are. Where you got some? Where are you? I see you got some stuff up on the wall there.
Yeah, I'm in my office at KGH.
So tell us a little bit about yourself, Dr. Rudan. What do you specialize in, and yeah, just generally, where are you from? What do you do? How do you do?
Yeah, okay, great. I can give you a little bit of that. So I'm an orthopedic surgeon, and I head the department of surgery. We have 56 surgeons in the department of surgery. That's not all the surgical departments. There are urologists, ophthalmologists. So in total in Kingston, from surgeons, there are about 100 of us, pretty close to 100 surgeons. And I happen to be the head of surgery and also the chief of perioperative care. This the guy that helps to look after making sure the hospitals ORs run and we have the facilities that people need for their surgical care. I'm actually a Kingston boy. I was born and raised in Kingston. I went to Sinclair School in formerly Kingston Township. I went to Frontenac High School and ended back up here at Queen's after doing my medical school here. So yeah, it's been a lifelong Kingston resident and loved every moment of it.
Can you tell us a little bit about the benefits of being an academic health science center?
Yeah. So an academic center is really an important thing. There are lots of healthcare facilities around. There are lots of hospitals around, and an academic healthcare center is one where we're affiliated with the university. We're part of Queen's University, and there are in Canada just 16 academic healthcare center hospitals or universities. So we are associated with the university. We're associated with Queen's University. We're integrally linked with the university. And what an academic center means is that not only do we do teaching of residents, those are our junior doctors who are training to be specialists in whatever area of specialty they would want to be in, but we also are part of the education of medical doctors as well. So the medical school at Queen's has about 100 medical students that they take in every year. It's the most competitive seat for medical school in the country by far. It's the one that is sought after by most students across the country, and that's housed here at Queen's and in our hospitals. And so what it means is we have a very rich and diverse group of people here at the at KHSC, where we are really providing levels of service to the community that are probably well beyond what you would normally have for a city of about 200,000 people. We serve a region of about 650 to 750,000 people. So all along, we're the only academic health sciences center between downtown Toronto and the Quebec border. Ottawa has their region up to the north. So if you have a complex care in any way, shape, or form, being affiliated and being an academic health sciences center means you've got the breadth of services and talent here to look after all sorts of different problems. So it allows us to subspecialize. We have a depth of service that we need to provide for our education to our residents and medical students that provides an enriched, if you will, healthcare opportunity for our community.
We've been hearing, about just Kingston and the great care that we have here and some of the best doctors. It's sort of the blessing and the curse, because yes, we're a small community and we have all these great people, but the curse is we represent that big region because we fall like smack dab in the middle there of, like you say, Ottawa and the Quebec border and Toronto. I wanted to get back to just being sort of like, the teaching aspect. Then I guess that would make you would theoretically then you could do surgery in the morning and then teach a class at Queen's later on in the day. Is that kind of how?
Yeah, we could do that. Yeah, we do, and we do that, and we have classes during the day. We also have on-site teaching. So in our clinics, if you were to come to our clinics, you'll see our learners in and amongst us. They're part of a team. It's a team-based approach. So we could have a team of young junior medical students, clinical clerks, which are the final year medical students. We'll have residents, young people who are doctors who've graduated from medical school, but they're doing subspecialty training, and you'll see those people at their various degrees of learning there. And we'll actually have post fellowship people. So people will have a wide range of learners in the clinical environment and in the operating rooms as well. So yes, we are in our labs, we are in our clinics, in our operating rooms, and in the lecture hall with our students.
I'm picturing like in the Seinfeld episode where Jerry and Kramer are like watching from up above the surgery going on, and he loses a junior mint. That kind of, you have rooms that are like kind of like that, I guess.
Yeah. No, we haven't lost too many of those mints in there. But you're right. I mean, it is like on television. There's there are learners here, and they're a big part of the team, and they're on the wards as well, helping to look after the patients and making sure that the patients get the care they need. So it is a learning environment for us all. We also have nursing school nurses here as well, and we have rehabilitation therapists. It's that kind of collegial team learning environment that we have at these institutions.
We almost made it 4 hours without Reed dropping a Seinfeld reference. So close, so close. Obviously,
he didn't do the golf ball in the whale.
Yeah, it's true. You've been talking about the hands-on learning and just the experiential learning that students get. Obviously, COVID would have thrown a bit of a wrench into how you do business, for lack of a better term. What kind of challenges are you seeing right now in these times?
Yeah, it is difficult. I think that, I mean, one of the safest places to be these days is from COVID is actually in the hospital. We have, we've got very few people in our region, and in the hospital we're fortunately been very good about not having the COVID patients very many in the institution. But the distancing, the social distancing, the physical space requirements that are required for that necessitates that we don't have our clinics fully operational, and we can't see as many patients as we want. So this morning, for instance, I just left my clinic. Normally I would see 40 patients in my clinic, and I saw 30 patients, for example. So it challenges that. Normally we would have had more clinics going. So it's difficult for us to get to see the patients physically as we would normally like to do. Now, fortunately, we have other ways of, we've been doing more telemedicine, and that's been very helpful. And I think patients like that too, because it's more, they can be seen at home and talk at home. But that's been challenging. Unfortunately, we've had to, in the early stages, we had to cut back our surgical cases because we had to make sure that we had enough PPE for all our patients that were potentially coming into hospital. So we use masks in the operating room and equipment. So we had to cut back on our surgery. And also we had to make room for beds because we thought that maybe we would might get swamped. So our waiting list grew larger, and we've not been able to get back to full capacity, although we're getting there. Each and every opportunity the ministry lets us, we move forward, trying to serve our community and meet their needs. I think the other thing that happens is I think that our patients are concerned, obviously.
Attention, please.
Sorry.
Dorothy Jackson, please report to birth 3.
They say it 3 times.
With Dorothy Jackson, please report to birth 3 renal unit.
That makes it legit.
Yeah.
There.
Ambient noise. It was great.
It's a real thing. Yeah. Yeah. No. So yeah. So I think our patients are anxious and they're concerned, and I can understand that. And so we have to understand that and take that into account, and let them know that despite the concerns, that this is that they'll be well looked after.
We're talking to Dr. Rudan, professor and head of surgery, Queen's University and Kingston Health Sciences Center. So obviously, we're doing this Stream-a-Thon to raise money for the University Hospitals Kingston Foundation. Talk about the impact that the foundation has on the work that you guys do over at whether it be Queen's or KHSC.
Yeah, and it really helps. It's paramount for the institutions to run and to serve the community as we do, and to keep up with all the new equipment and all the new things that are required, from our new MRI scans, our new PET scans, having all those pieces of equipment helping to refurbish operating rooms and to provide the latest and greatest in equipment. It requires the community's support for this, and the foundation's a key and integral part of this. And as we grow our community that we serve, and as we have a broader range of more highly complex services that we provide, we need the support of the community to do that. We have robotics here that came. We've got robotics program that really was made possible through donations. It's allowing us to do things much they're first world, first class operations that we do extremely well. We've always been at the front edge of things, and it's hard to sometimes do that unless you have that additional support. The ministry, they provide the bread, but we have to have butter and things to make it work as well. And the donations we get are absolutely essential. And I just caught one thing that you had said before about every bit counts. Every bit does count. It really all adds up. This is it's a big community in space, but it's also quite a lot of people. We think of ourselves as being rather small, but in fact, our community, we serve a population of greater than New Brunswick in the population, greater than Newfoundland, and so on. So it's actually, it's not a big metropolitan area like Toronto, but it still serves a large population of people. So every donation we get, no matter what the size, helps, and we greatly appreciate it and need it.
And those donations, again, big or small, we've got a matching donor, $25,000. So any amount in there will be doubled. So whatever can be passed along would be so helpful. I think it's perhaps the most important question that we've asked someone today. You mentioned robotics. How close are we to robot doctors?
Well, as everybody, I do computer-aided surgery, and I work with a lot of very smart computer scientists and artificial intelligence people. And I keep on telling them that the biggest brain in the world is mine. They've got to work pretty hard. No, we're a ways from that, but artificial intelligence is very helpful, and we use it all the time. That's one of the nice things about when you touch on that. I mean, we have collaborations with people across the university, and I think I should bring that out. Is our opportunities to work with. We are one of the things that we really are pride ourselves on. We are a world-renowned image-guided surgery group here at Queen's. And there's a meeting going on in Munich right now, and actually we just took one of the prizes at that meeting amongst computer scientists and engineers and radiologists and surgeons for new technology that was developed here, and it's part of what we do, and having those collaborations allow us to be at the forefront of the world's research and trying to bring better care not only to our community but hopefully to the world as well.
What is it? Why do you think we have such talented doctors and healthcare workers here in Kingston and working with Queen's University at Kingston Health Sciences Center? What is it about this area and why we have this great talent here and why we are world renowned, as you put it?
Yeah, it's really interesting. I think it's a very good question. I think first of all, Queen's itself is a world renowned university. Canadians also know Queen's University. We are actually one of the very few universities in the country that really is its whole raison d'etre is actually to serve the needs of Canadians. So we are not a regional school. So it's not like in Ottawa that primarily would serve the Ottawa community, and many of the other provinces where they have their medical schools serve the community in the province they're in. Queen's, because of its size, we open ourselves up to the national and to the international. And so as a result, people get to know us beyond our boundaries, and it broadens our interest in other people and other people's interests in us. And we get great students, and great students make great doctors and make great researchers. And I think that really is a beautiful place to live, and it's a nice location, and it's a great learning and environment as well.
You must be pretty excited. We've talked. We're getting close to the end of our Stream-a-Thon, but we've talked a lot about this redevelopment center. You must be pretty excited about this and how it's going to affect the doctors, the surgeons that work under you.
Yeah, we dearly need the new operating theaters. it's wonderful what we have. We make the best use of what we have, but having the new opportunities to move into a new environment, bigger, better in all other aspects. Some of the workarounds that we have to do now makes it difficult, but yeah, we're really looking forward to it. And it's transformational. And I think that the other part about this is that it's a real affirmation of the people in Ontario saying that Queens is a great place. This is why we want to build a tower and build and invest in this area, because they appreciate what we do here is really worth the investment, and hope and expect that our community will continue to support it as the province is supporting our growth and development of the new tower.
And yeah, no, as we've been, Ben, are you still there, or did we lose Ben along the way?
Still there.
Oh, okay, still there. And as we've been learning too, with the Stream-a-Thon, if you didn't know, prior to this, that yes, the government is green lighting money for it, but it's only 90% of the building cost. We've certainly found out that it costs a little bit more than obviously just building the building, but then all the equipment and the new beds and all the other fancy names for equipment that Ben and I don't know how to pronounce or don't know about.
It's a long list of things that we don't know.
Yeah, but I can tell you that the foundation is aware. The foundation is building and understands that and how to do it, and very much we appreciate the community's support to help make this all possible. It's a very special opportunity and very special place we have here, and I'm sure the people that are hearing you really know how special the opportunity is to have this facility in their area.
We know you're a busy guy, and we appreciate you spending some time with us on the Stream-a-Thon, and we'll continue to encourage people to help donate towards University Hospitals Kingston Foundation. Big thanks to you and your whole team and everything that you guys are doing to do that just important work that you do every single day. So we're just want to say thank you and try to raise some money here. And yeah, great talking to you.
Great talking to you too. And thank you both very much for the support that you're providing. It's been my pleasure.
All right. Take care. Have a great day.
You too. Bye-bye now.
Bye-bye. That's Dr. Rudan, professor and head of surgery at Queen's University, Kingston Health Science Center. We have got still about another 15 minutes or so to go on our Stream-a-Thon. And we're going to jump right back into another guest. We have with us Crystal Mack, I do believe. She's an administrator at Providence Care Long-Term Care Home. Crystal, are you there? Hello, check.
Yes, sir, I am.
How are you, Crystal?
Very well, thank you.
Okay, so I'm being told you have no video. We're just chatting with you.
We're just chatting. That's right. My video wouldn't work for me today for some reason.
A lot of people were hoping our video wasn't going to work today.
It's the whole face for radio thing.
Yeah, exactly. That's an old face for radio joke. No one said anything about Stream-a-Thons when we got into this business, but we're having a lot of fun about it. And, just learning a lot. And hopefully people who've been checking out the Stream-a-Thon have been getting a little sneak peek, pulling the curtains back a little bit, if you will, of what goes on inside our hospitals. So as I mentioned, so you're the administrator of Providence Care Long-Term Care Home. Talk a little bit, like I like to just ask our guests that come on, just a little bit about who you are. Anything you want to share with us about who you are and the job that you have here in Kingston.
Well, I'm, as you say, the administrator here at Providence Manor, and I've basically grown up at Providence Manor. I've had an extensive history with Providence Manor, had some time away, break in service, but came back. This is my home. I've basically started here since I was 19 years old and worked my way, did PSW work, did recreation staff, did administrative nursing, did education. So it really does feel like home for me. And it's pretty a great place to work, pretty great place to be. So
can you tell us a little bit about the new project that's happening with Providence Manor and what kind of a difference that will make once it's completed?
Yeah, we're really excited about the new development at Providence Manor. We've been meeting with a steering committee since 2018, and we had extensive consultation with staff in all departments, residents and their families, volunteers, community groups, and we're just really had a lot of input about the way people want to see this building to come to fruition. And we're really confident that with that type of consultation that we're going to be able to serve the community well into the future. We look at all the opportunities that we have to modernize the building, to look at modern accessibility standards, and look at an improved outdoor space. We've got a beautiful garden here at the home presently that residents can access, and a couple of other courtyards that are accessible, but we really look forward to the improved access to outdoor space. Just with the green space that's going to be available in that new home in the Providence Village. And just, I guess some of the other things are just improved technology. And I was thinking, you know, it's kind of ironic that I couldn't get reception or transmission today out of the building. And I'm thinking maybe there's a case in point for the redevelopment.
That's a great thing, and it was all designed to show how much the money is needed for technology. We can't get her on Zoom right now. Go carry on, Crystal.
No, I just think we're really looking, forward to, as I say, modernizing the space, and we give outstanding care here, but we're looking forward to that being able to be maintained and exceeded with new innovations that the new building will offer us the opportunity to institute.
And this will be obviously a bigger building, and if I'm not mistaken, too, it's going to be like close to our radio station here at 93.5 FM. We're at 993 Princess Street, but we're almost going to be neighbors, right?
Practically, yeah. We're going to be up at where the Sisters of Providence currently have their mother house at 1200 Princess. So right at the corner of Princess, pretty much, in Sir John A. there. Yeah. And so that's why you can, anybody that's sort of been by there can see how that affords us the beautiful opportunity to be having the green space around us.
Can you tell us a little bit about the situation of the past few months and maybe how staff and residents have had to pull together with all of the challenges that we've all been facing over the past little while?
Yeah, I mean, this team is a spectacular team at the best of times, and just I think we continued to show our true colors in all of this. The staff has really stepped up to the plate, and I think with our community partners, it's just been a real spectacular team effort. We work well as a corporation, the expertise and knowledge that exists in the larger corporation of Providence Care, but working with our partners in infection control and occupational health, community partners like public health, like KHSC and other health agencies, and just the way that everybody internally has worked extremely well together. People sort of willing to stretch and do things that they haven't been that aren't really in their normal job description. Think of one example is we have hairdressing in the home, employed by the home. And because the ministry mandated that hairdressing stop as part of this whole process, the hairdressers, happily supported other activities in the home. When we had residents moving about the home, a couple residents made the decision to move out of the home, so they were assisting residents to pack and get ready for that transition. They picked up the screening activity. That's one of the big activities that happens at the front door when people come and go from work. And so they were able to support that type of activity. And actually at one point we said, well, hair care is your specialty. How about heading up into the home and not charging residents, but being supportive of making sure that people feel, groomed well and support the hair care. So that worked out really nicely. But yeah, just overall, I think it's just been such a heartwarming experience, really. With everybody working so well together, and some of the fun stuff that the recreation team has been doing things like building an ice cream cart out of a cardboard box and painting it all up to look like an ice cream cart and going room to room, because we were, of course, not allowed to have congregate gatherings for recreation programs. And then just also supporting staff with fun things like treats. We've got a big treat table at the front door. We had a couple vendors from the city that donated some goodies for the staff. And yeah, just trying to maintain contact with residents, families through Skype and FaceTime, and most recently the outdoor visits. So that's
yeah.
type.
Yeah, no, and I was just gonna say it really is a testament to show to the the healthcare workers that work at Providence Manor and in Kingston in general too, with the long-term care. We heard some stories, some really kind of sad stories over the past couple of months of outbreaks and the treatment of some residents in long-term care homes, and while it's really unfortunate to hear those stories, it really is it makes you feel proud to know that we haven't had any outbreaks here in Kingston, and that everybody's been staying safe, and we've been doing a good job at that. And that's a testament as to some of the stuff that I think that you were just talking about.
Yes, I think we have our mission and values are based in the legacy of the Sisters of Providence, and I think that really is the root of why we do what we do and how we do what we do. And I think that is it's always apparent, but it's particularly apparent in this event of COVID-19. And I just really honor the staff for their dedication and their love and their time and their energy that they give to the residents every day. Crystal Mack from Providence Long-Term Care Home, the Providence Manor, pardon me. Really appreciate you joining us this morning this afternoon. I keep still saying this morning, even though we're like almost 2 o'clock in the afternoon. Appreciate you joining us this afternoon on the Stream-a-Thon. And yeah, we will continue to encourage people to donate to University Hospitals Kingston Foundation and help raise money for this new Providence Manor that we hope to see in the next few years. So thanks for spending some time shedding some light on the situation over there, and have yourself a great day. Thank you. You too.
It's Reed and Ben along with 98.3 Fly FM and our sister station Pure Country 99 as well, doing the Stream-a-Thon here and asking you to continue to donate, Ben, getting those match donations too, which is fantastic as well. Are you still there, Ben? All right. I'm on my own. Ben is gone. His phone has probably died again. So we're getting set to wrap things up, but we're going to allow the website you can still go there and donate. Once again, it's the International Brotherhood of Electrical Workers, Local 115. Donations up to $25,000 are being matched. So even the smallest donation goes a long way. We can't thank you enough. We're up over $8,000 right now, $8,300, which is absolutely fantastic. And you can keep donating. And we really appreciate you checking out the Stream-a-Thon and hopefully learning a little bit about the great work that our healthcare workers do and University Hospitals Kingston Foundation. So a big thank you to all the guests as well that have joined us here today and helping us put together this Stream-a-Thon. Along the way too, we've had some great entertainment from from various guests, talking with Brittany, our program director over at Pure Country, chatting with various guests and performances. And that is how we're going to leave the Stream-a-Thon here today. Once again, it's back to George Canyon, who's going to do a performance of Speed of Life here on the Stream-a-Thon. So thanks again, everybody, for checking it out. And yeah, we'll let George Canyon take it away. Have a great day, everybody.
"13 wants to be 16. 16 can drive a car. 16 wants to be 21. 21 gets to hit the bar. 21 wants to be 30. 30 feels too old. The world keeps spinning round and round, round and round we go. We're all just moving at the speed of light. Feel the wheel in motion. No fast forward and no rewind. Chain that can't be broken. Can't slow down the hands of time. Waves upon the ocean. We're all just moving at the speed of light, the speed of light. smile leads to a first kiss to a diamond. A diamond ring brings the sweetest thing, keeps you up all night crying. Kindergarten, senior year, so long, mom and dad. That smile turns into 30 years, they fly by just like that. We're all just moving at the speed of life, feel the wheel in motion. No fast forward and no rewind, chain that can't be broken. Can't slow down the hands of time, waves upon the ocean. We're all just moving at the speed of light, speed of light. We only get so many trips around that setting sun. You know we gotta make the most of each and every one. We're all just moving at the speed of life. So enjoy the ride, yeah, enjoy the ride. We're all just moving at the speed of life, feel the wheel in motion. No fast forward and no rewind, chain that can't be broken. Can't slow down the hands of time, waves upon the ocean. We're all just moving at the speed of life, the speed of life. 13 wants to be 16. 16 wants to be 21. 21 wants to be 30. We're all just moving at the speed of life, the speed of life.